Honorable Mohadi, you have the floor.
Thank you, moderator. The Speaker of the Parliament of Zimbabwe, Honorable Advocate JFN Mdenda, the Clerk of Parliament of Zimbabwe, Mr. Chokuda, Honorable Members of Parliament here present, the Secretary General of the SADC-PF, Ms. Boyemus Koma, our distinguished resource persons, staff from the Parliament of Zimbabwe, staff of the SADC-PF, members of the press, invited guests. Let me begin by recognizing the presence of the Speaker of the Parliament of Zimbabwe, Honorable Advocate JFN Mdenda. I also recognize honorable members present here. We will now proceed with the introductions, beginning with the honorable members of Parliament, to be followed by the rest of the participants. Over to you. We will have self-introductions.
Good morning to you all. My name is Honorable Dr. Nyashanu, Member of Parliament for Boera Central and Chairperson for the Committee on Budget, Finance and Economic Development in Parliament of Zimbabwe.
Thank you. Can we have other members following suit?
Good morning, everyone. My name is Eliam Sakwa. I'm Member of Parliament for Bigita West constituency. Thank you.
Good morning, everyone. My name is Dauti Ndiwe, Member of Parliament for Windows Central. Morning, everybody.
Hello, everyone. I'm Honorable Nkani Andrew, Budget and Finance for Zimbabwe. Thank you.
Good morning, everybody. My name is Nicola Watson. I'm the MP for Bulawayo Central constituency and a member of Budget and Finance and Health Committee.
Morning, everybody.
My name is Joshua Wellington Sole, Member of Parliament for Wange East, a member of the Budget, Finance and Economic Development Committee. Thank you.
Good morning. I hadn't finished my introduction. I happen to be a member of SADC Executive Democratization, Governance and Human Rights Committee in the SADC Parliamentary Forum. Thank you.
Morning, everybody. My name is Tapera Sais, Member of Parliament from Zaraban South constituency. And then,
Good morning, everybody. My name is Matthias Strongofa, Member of Parliament for Chiwi North constituency and a member of the Health Committee.
Good morning, everyone. My name is Daniel Mulokele. I'm the Member of Parliament for Wange Central constituency and also a member of the Portfolio Committee for Health and Childcare.
Good morning to you all. My name is Goodluck Kwaramba, Member of Parliament for Mashonaland West Province. I sit in the Health Committee, and I also chair the Zimbabwe Women Parliamentary Caucus. I thank you.
Good morning, everyone. My name is Lwaziswanda, a member of Matabele North Province. I am in the Healthy and Child Care Committee. I thank you.
Good morning, everyone. Good morning, everyone. My name is Salani. A member of Parliament from the constituency. I'm a member of the Health and Child Care Committee.
Morning, everyone. My name is Violet Nari, Member of Parliament for Midlands Province. The Health Committee is my committee.
Are we through?
Good morning, everyone. My name is Teresa Lam, Member of Parliament from Mike Central.
Hi, good morning. My name is Justice Mayor Wajgajena. I'm the chairperson for the Parliamentary Portfolio Committee on Lands, Agriculture, Water, Fisheries, and Rural Settlement. I'm also the Member of Parliament for Gokene-Mbudzia constituency in the Midlands Province. Thank you.
Good morning, everyone. Sitole James is my name, MP for Makokoba constituency. I'm also a member of the Lands, Agriculture, Water, Fisheries, and Rural Settlement. Thank you.
Are you through? Okay. Can we have the other participants who are present there to introduce themselves?
Greetings to you all. My name is Elizabeth Mpofu, a small-scale farmer, the former chairperson of Zimbabwe Smallholder Organic Farmers Forum, and also the general coordinator of a global peace and movement called La Via Campesina. And I am also the co-founder of the African Women Collaborative for Healthy Food Systems. And I'm based here in Masvingo at Shasha Agroecology School. Thank you.
Thank you. Next.
Good morning, honorable members. My name is Shaunen Kurasha. I'm the program manager for democracy and governance at the SADC Parliamentary Forum. I'm also responsible for parliamentary business. While I have the floor, let me have the honor of introducing the Secretary General of the SADC Parliamentary Forum, Madame Sehoma, Boemo Sehoma. She's in the meeting. Good morning, Madame SG. Thank you, Chair.
Thank you. Good morning, SG.
Good morning, Honorable Hati. Good morning, honorable members.
Thank you. Do we have any other members who have not yet introduced themselves?
Good morning, Honorable. My name is Pepkai Chuore, Director, Parliament Budget Office.
Thank you. If we are done, then
my name is Light Moyo. I am with Action Aid Zimbabwe. I'm here with a team of the PSA consortium, whom I'll ask to individually introduce themselves, if that's okay.
Proceed. Are you there?
Yes, we are there. They're just coming through.
Good morning, honorable members. My name is Moni Owen, and I'm also about
Good morning, everyone. I'm Ida Director, Institute member from Polo District. Good morning, honorable members. My name is Tungedo Mzina. I'm a member of the Zimbabwe Small World Organic Farmers, and I also represent the region in Southern East Africa in the global movement called Nigeria. Good morning, everyone. My name is Mavis Gofa, a youth smallholder farmer from Zimbabwe.
Good morning, everyone. My name is Takuto Shoko. I'm graduating here from Suffolk, Zimbabwe office.
Good morning, everyone. I'm Shalom Zamba. I'm the theater facility. Good morning, everyone. My name is Norman Messi. I work under Wesley Star.
Good morning, everyone. My name is Jacob Gender from June. I work University.
Good morning. My name is Henry Singili. I'm the coordinator for ESAF Zambia.
Good morning, honorables. My name is Carolina Makumbe. I'm with SAF as the country coordinator, and I work with facility on adolescent girls and young women to promote HR services. Thank you.
Good morning. My name is Shukita Koli. I'm the Women's Rights and Economic Justice Manager for Action in Zimbabwe. Good morning, everyone. I'm Danita Mugimba from Varsity Church Mugimba. I work with the young girls and the young women on sexual and reproductive health and rights services. Thank you. Thank you, Honorable. That's all.
Yeah, thank you. Then we shall proceed with the remarks. Honorable members, ladies and gentlemen, it is with a great honor and privilege to welcome you all to this important meeting. Let me extend a special welcome to the Speaker of the Parliament of Zimbabwe, Honorable Advocate J.F. Mudenda, and all honorable members. I further welcome the Secretary General of the SADC Parliamentary Forum, SADC PF, Ms. Boyema M. Segoma, and Ms. Julie Middleton, Manager of the Partnership of the Social Accountability PSA Consortium. Honorable members, ladies and gentlemen, this meeting has been convened through collaborative efforts between SADC PF and PSA. I wish to place on record the gratitude of the Parliament of Zimbabwe for according us an opportunity to host this meeting. May I also take this opportunity to extend our gratitude to the resource persons for taking their time out of their busy schedules to be with us this day. Honorable members, ladies and gentlemen, allow me now to give a brief background to this meeting. The SADC PF is in collaboration with the PSA is implementing a 3-year project on strengthening social accountability and oversight in health and agriculture in Southern Africa. The main objective of this project is improved accountability and gender responsiveness in public resource management, particularly in the areas of human immunodeficiency virus, HIV, and sexual and reproductive health, SRH, services for adolescents, youth, and agricultural services for smallholder farmers. Ultimately, this will contribute to the realization of selected SADC regional commitments across 5 countries, namely Malawi, Mozambique, Tanzania, Zambia, and Zimbabwe. Honorable members, ladies and gentlemen, you may wish to note that in May 2021, the SADC PF, together with the PSA, convened a joint meeting of the SADC PF Standing Committees on Food, Agriculture and Natural Resources, FUNDRE, Human and Social Development and Special Programs, SHDSP, and Gender Equality, Women Advancement and Youth Development, GEWAD. Among other notable issues that were discussed during the joint meeting include how public service accountability monitoring can be used as a tool to enhance social accountability in the implementation of SADC regional commitments. The meeting also deliberated on the SADC commitments on sexual and reproductive health and rights, reproductive health and rights, SRHR. In addition, factors impeding effective social accountability in both the health and agricultural sector were also subject of discussion at the joint meeting. Honorable members may recall that the report of this joint meeting was tabled and debated on during the 49th SADC PF Plenary Assembly. It is gratifying to note that the Plenary Assembly made study resolutions aimed at enhancing social accountability in the health and agriculture sectors. However, this does not automatically translate into success unless respective member states create an enabling environment to ensure implementation of the resolutions. Honorable members, ladies and gentlemen, the health and agriculture sectors are among the top priorities on the agenda of SADC PF region. The success of these two sectors can contribute immensely to the attainment of some of the regional commitments and global development goals. For this to happen, we need to identify and find solutions to some of the challenges that beset both the health and agriculture sectors. Some of these challenges include, but are not limited to, poor provision of sexual reproductive health services in some SADC countries, including Zimbabwe. With regard to agriculture, the sector is also marred with a number of challenges, such as failure to involve farmers, particularly smallholder farmers, in decision-making processes. It is a well-known fact that women play a critical role in agriculture in Zimbabwe. However, they do not fully participate in agriculture as they face numerous barriers, such as limited access to and ownership of productive assets as they relate to land and agricultural inputs, among others. Honorable members, ladies and gentlemen, The health and agriculture sectors in Zimbabwe share one common problem among others, and that has to do with inadequate budgetary allocation. This is a huge hindrance that is preventing effective implementation of programs that are meant to ameliorate some of the challenges that I earlier alluded to. As parliamentarians, we're eager to learn how we can leverage our oversight function in order to enhance social accountability in the health and agricultural sectors in our country. This is critical as it will contribute to the socio-economic development to Zimbabwe and the entire SADC region. Let me not preempt what our resource persons have prepared to share with us. Once again, I welcome you all to this important meeting and I hope that we will have fruitful discussions. With these few words, tinotenda, siyabonga, riyaleboha, asante sana. Thank you.
Thank you very much, Honorable Mohadi. Before I call upon Mrs. Makoni to give her remarks, please allow me to call upon Ms. Middleton, the project manager for the Partnership for Social Accountability Alliance, just to introduce herself. She didn't have an opportunity to do so. Ms. Middleton, please.
Thank you very much, Sharon. Thank you, everyone. It's a pleasure to be here with you today. I just wanted to introduce myself and say that I'm the project manager for the Partnership for Social Accountability Alliance based at ActionAid International in South Africa. And we're very pleased and excited and appreciate the partnership with the SADC Parliamentary Forum, as well as the Parliament of Zimbabwe in hosting this meeting. So thank you, and we look forward to today's proceedings.
Thank you. Mrs. Makoni, the Program and Project Manager, Women Rights and Economic Justice, you have the floor.
Thank you very much. The Speaker of Parliament of Zimbabwe, Honorable Advocate JFN Mudenda, the SADC PF Secretary General, Boema Segoma, the honorable members of the SADC PF Standing Committees on Human and Social Development and Special Programs, Food, Agriculture and Natural Resources, and Gender Equality, Women Advancement and Youth Development, honorable members of Parliament from the portfolio committees on Land, Agriculture, Mechanization and Irrigation, Budget, Finance and Economic Planning, Health and Child Care, SADC Parliamentary Forum Secretariat, the Clerk of Parliament, Mr. Chokuda, Parliament of Zimbabwe Secretariat, Partnership for Social Accountability Alliance Consortium members, civil society partners, ladies and gentlemen. A good morning to you all. It is a unique honor for me to welcome you on behalf of ActionAid Zimbabwe to this important national dialogue on social accountability and oversight in the implementation of SADC regional commitments in health and agriculture in Zimbabwe. This meeting stems from a commitment taken to hold national dialogues following a regional dialogue focused on social accountability and oversight in the implementation of SADC regional Commitments in Health and Agriculture, held by SADC-PF in partnership with the PSA Alliance in May 2021. This meeting will deliberate on how SADC-PF members and parliamentarians in Zimbabwe can critically assess the implementation and monitoring of regional agreements in agriculture and health that the country is signatory to. SADC's Vision 2050 and Regional Indicative Strategic Development Plan 2020 to 2030 recognize the good governance through enhanced social accountability is an important enabler in eradicating poverty in the region. This is also reflected in the country's national blueprint, the National Development Strategy 1, and the Constitution of Zimbabwe. The Constitution, in Chapter 16, makes a number of provisions which impact on public finance management to ensure sound fiscal management, which is the bedrock of socio-economic development. These include the following: giving Parliament the right to oversee state revenue and expenditure, requiring an act of Parliament to set limits on state borrowing, public debt, and state guarantees. However, the COVID-19 pandemic has placed before the region and Zimbabwe both additional hurdles as well as opportunities towards the achievement of socio-economic development. COVID-19 has exposed pre-existing gaps in the delivery of public services, particularly for the most marginalized, and demonstrated the importance of consistent and sufficient public investment and accountability and accountable governance of health services, domestic food security, and social protection systems. Women, who form the majority of the small-scale food producers, have been at the forefront of the ongoing HIV pandemic, and they have again been called to the front lines as caregivers and health workers, invariably shouldering the heaviest burden. Weak public health systems have been further weakened as already mere resources have been redirected to curbing the pandemic. The diversion of human resources, infrastructure, and commodities has meant that basic services, including sexual and reproductive health services, have been scaled down, and access by those who need them has been limited. The social impact of COVID-19 has also exacerbated gender-based violence. While some efforts towards preventing and addressing the negative impacts of COVID-19 are being taken, more needs to be done across the sectors. In addition, the government continues to roll out the vaccination program countrywide to reduce both morbidity and mortality from the pandemic. ActionAid Zimbabwe has been playing its part towards ensuring attainment of economic and climate justice for all within the country, reflected by taking sides with people living in poverty through partnership with local community-based organizations, national and international non-governmental organizations, civil society organizations, various tiers of government, and other like-minded organizations in Zimbabwe. Under the Partnership for Social Accountability Alliance Consortium, efforts are being made to increase the participation of citizens, particularly marginalized groups such as young people and women smallholder farmers in setting the national agenda, as well as strengthening the ability of all stakeholders to collectively identify public resource management issues and act to address these. This meeting comes at a time when approval for the transformation of the SADC PF to a SADC Parliament has been made at the just ended 41st SADC Summit in Malawi. This is commendable and will ensure that the citizens' voices are incorporated at regional level. In line with ActionAid's call on enhanced civic participation. Furthermore, ActionAid Zimbabwe acknowledges the cordial working relationship it has with the Parliament of Zimbabwe, showcased by the Memorandum of Understanding signed in 2020. This has seen collaborations on initiatives such as capacity building and implementation of the African Charter on Democracy, Elections, and Governance. Policy dialogues on gender-responsive public services, among many. It is my hope that this will continue in the future and be reflected in the social and economic justice of the country. In this endeavor, ActionAid Zimbabwe believes that this meeting will forge ways and make recommendations to ensure efficient and effective adoption nationally of regional instruments on agriculture and health, such as the Africa We Want, revised Maputo Plan of Action 2016 to 2030, and the Abuja Declaration on Health Funding. Comprehensive African Agriculture Development Plan and the Malabo Declaration on Accelerated Agricultural Growth and Transformation. This will be realized through national level domestication, implementation, and oversight. ActionAid Zimbabwe underpins the important legislative oversight, budgetary and representative roles parliamentarians play to ensure Zimbabwe achieves development goals stated in the NDS 1. In conclusion, this forum presents a grand opportunity to make the linkages between SADC and national level commitments. Let's find innovative ways to create spaces for such conversations right up to community levels in Binga and Mutoko to ensure increased civic participation and state accountability for the redistribution of resources and delivery of quality, gender-responsive public services. Thank you for taking your time out of your busy schedules to be here. Wish you fruitful deliberations. I thank you.
Thank you very much for those elaborate remarks. It is now my rare honor and privilege to call upon Honorable Dr. Matthew Nyashanu, the chairperson of the Portfolio Committee on Budget, Finance, and Economic Development, to give the keynote address. Dr. Nyashanu, sir, please.
Thank you so much, Madam Moderator, for the invitation. Honorable members of Parliament, Secretary General of the SADC PF, Parliament staff, distinguished guests, members of the press, ladies and gentlemen. Let me from the onset express my delight and enchantment for being in your midst today and having been accorded the honor to address you on this auspicious occasion, which aims at strengthening social accountability and oversight in the implementation of SADC regional commitments in health and agriculture. First and foremost, let me start by expressing my sincere gratitude to the SADC PF for this invitation, which I accepted with great honor. It is common knowledge that our region faces several development challenges, and the health and agriculture sectors, which have a direct bearing on the lives of people, cannot be overlooked. The outbreak of the novel coronavirus COVID-19, first detected in China in the late 2019, has led to huge economic cost on the global economy, and the SADC region has not been spared. The COVID-19 pandemic has shown itself world over to be more than a health crisis and has had devastating social, economic, and political.
Honorable Nyashanu, sorry to interrupt you. Sorry to interrupt you, sir. We're kindly requesting that you switch on your video for purposes of broadcasting.
All right. Okay.
Thank you, sir.
Thank you. Thank you. Thank you. I think you can see me now. Hello, Madam Moderator.
Not yet, Honorable. I'm not able to see you. I don't know if other honorable members and participants are able to see Honorable Nyashanu.
We can't see
for
him.
one cannot see him. I can't see him.
We can't see you, Honorable.
We can't see him.
Can't see you.
You can see me.
I can see him.
Yeah, but what happens if
I can see him.
Yeah, we can see him now, but he's on and off.
We
Yeah,
saw you
he's on and
briefly.
off.
We saw you briefly.
We saw him on and off.
He's very clear. I can see him.
the regional economy is expected to have contributed to have contracted by 4.8% in 2020, mainly due to the COVID-19 pandemic. The pandemic came at a time when the region was already grappling with high levels of disease, social and civil conflict, natural disasters such as recurrent droughts and floods that reduce food security, among other challenges. These challenges have been amplified and exhibited through high levels of migration within and out of the region. Indeed, dear colleagues and invited guests, it is time to sit down and do a close reflection. Honorable members, distinguished guests, ladies and gentlemen, the regional economic indicators for 2020 pointed southwards, with the region, the SADC region, annual inflation increasing to an average of 49.6% in 2020 from 16.4% in 2019. Moreover, fiscal deficit deteriorated from 3.6% of GDP in 2019 to 7.3% of GDP in 2020. Public debt increased from 56.3% of GDP in 2019 to 67% of GDP in 2020. These shocks and challenges had significant negative effects on the region's already existing food deficit, health systems, and livelihoods. As recognized by the United Nations Sustainable Development Goals, the African Union Agenda 2063, as well as the SADC Vision 2050 and Regional Indicative Strategic Development Plan 2020 to 2030, good governance through enhanced social accountability is an important enabler in eradicating poverty in the region. While SADC member states are signatory to multiple regional, continental, and international instruments that aim to address these challenges, their objectives can only be realized through national level domestication, implementation, and oversight. National parliaments therefore face an enormous challenge and the opportunity at once to ensure that the long-term recovery does not stray from the shared global compass of the Sustainable Development Goals, as well as the regional commitments. To rise to this challenge, legislators will need to reinvent and reinvigorate their ways of working. This requires them to reassert their role as a vital democratic organ that determines people's needs and ensures that these are made through governmental action during the volatile times ahead. Honorable members, distinguished guests, ladies and gentlemen, it will be remiss of me if I don't point out the importance of agriculture to many SADC countries. Food security and social stability in the region is strongly influenced by the performance of the sector. Apart from ensuring reliable access to adequate food, which is a fundamental requirement for human well-being, the sector plays the economic role in the region, contributing between 4% and 27% of GDP of the different member states and approximately 30% of overall export earnings. Moreover, about 70% of the region's population depends on agriculture for food, income, and employment. The importance of agriculture to economic growth, socio-economic development, and poverty reduction in SADC member states is well articulated in the SADC Common Agenda, as articulated in the SADC Treaty of 1992 under Article 5. On the other hand, the SADC Protocol on Health, signed in 1999, lays the cornerstone for health development in the region, which is facing numerous challenges ranging from HIV/AIDS, malaria, access to pharmaceuticals, and inadequate health facilities, just mentioned but a few. A pressing issue in the SADC region is a lack of coordinated access to healthcare. The need for health programs that ensure attainment of the regional health declarations and targets, therefore, cannot be overemphasized. Honorable members, distinguished guests, ladies and gentlemen, allow me to delve into the concept of social accountability, which forms part of the principal discussion issues of today. The concept of social accountability has its roots in political science, theories of public administration and development studies, including rights-based approaches and participatory governance. Social accountability is seen as a means of strengthening community participation. It implies that political and governmental actors, including public service providers, are held to account for their actions and decisions by citizens. Public service providers are thereby expected to actively respond to citizens' demands, requiring a behavioral change towards more openness, discussing poor performance and willingness to improve the power of service users and accountability, and eventually to adapt service delivery practices. The social accountability concept, gaining rapid acceptance as a way to address service delivery inefficiency and improve basic public service performance, including planning and service delivery, and contribute to the attainment of the highest possible standards of living. Fox J.A.S., in his writings, The Social Accountability, rightly observed that social accountability strategies try to improve institutional performance by bolstering both citizen engagement and the public responsiveness of states and corporations. This is done through the provision of a set of approaches and tools to promote citizen engagement and monitoring to improve system performance, effectiveness, and responsiveness to public needs. Effective social accountability is enabled through regular feedback loops between principals as active holders of fundamental rights and the agents who are the duty bearers at both national and local level. Honorable members, distinguished guests, ladies and gentlemen, if we are to entertain any hopes of achieving an effective social accountability system, citizens must be given information about policies and decisions that are of public interest. These include these regional commitments and progress towards attainment of their aspirations thereof. It is not sufficient for such information to be easily accessible. Stakeholders need to make aware that this information exists and to understand where and how to access it. Following closely from this is direct engagement by citizens. In exercising their right to information, citizens must feel confident that it is feasible and worthwhile to challenge that information. In other words, that there is not an undue level of risk to them in voicing concerns, and that doing so will elicit an appropriate response. Apart from providing the public with reliable and up-to-date information, maintaining an inclusive dialogue and monitoring people's experiences as we implement health and agriculture commitments is key to ensuring that measures adopted have no one left behind. It has to be noted that during the crisis, a sudden influx of funds, including international assistance, and an urgent mobilization of infrastructure, goods, and services may bypass anti-corruption and transparency standards in procurement processes and create opportunities for abuse. In addition, it is agreeable that the urgent need for expertise and leadership to spearhead crisis responses opens the door to circumventing public appointment standards and processes. By holding the government to account for its management of public resources and expenditures, Parliament is at the center of the domestic accountability cycle. Honorable members, distinguished guests, ladies and gentlemen, it is worrying that the institution of Parliament is sometimes reduced to making rubber stamp decisions on regional and international treaties, protocols, and other instruments, often without any debate on these. In some legislatures, such instruments are not being subject to proper parliamentary scrutiny. The instruments therefore continue to be passed through Parliament instead of being passed by Parliament, resulting in lack of ownership by the legislature. Oversight and domestication of such instruments, therefore becomes a challenge as the legislator is not fully part of the process. And this leads to a slowing integration process in the region. This in turn results in people not participating and adequately benefiting from the regional integration and regional driven health and agricultural development. Parliaments have a role of ensuring accountability and constructive criticism of instruments, the implementation process, and the seriousness of the executive allocating and implementing resources. It is also disturbing that SADC instruments, even international protocols, despite Parliament's ratification, lack domestication and implementation, mainly due to insufficient, if not total, non-involvement of civil society players in the process. Parliament therefore has a bigger role to play by joining hands with civil society organizations to oversee implementation of instruments, forging of strong ties between Parliament and civil society, enables parliamentarians to benefit from well-researched information in their advocacy work while keeping these issues on the political agenda. Honorable members, distinguished guests, ladies and gentlemen, as I conclude, let me emphatically point out that the rhetoric around improvement in health and agricultural investment needs to be made by financing and implementation to ensure that the region move along the same wavelength. As parliamentarians, I challenge you to oversee allocation of resources to implement the regional commitments. You must use your power of the PACE lobby for provision of substantial, adequate, timely, and predictable financial resources to the sectors in compliance with regional commitments and funding thresholds before passage of money bills. In conclusion, honorable members, and perhaps most important, through your power of scrutiny, agenda setting, public engagement, and outreach, you must urgently honor the 2030 Agenda's pledge of leaving no one behind. The pandemic has exposed deep-seated inequalities the world over, placing disproportionate costs on those already vulnerable, including the global poor, the informal sector, migrant laborers, daily wage workers, and refugees. Many of the most vulnerable among them are women. Your electorate deserves seamless service provision from the duty bearers. Let me end here by wishing you all fruitful deliberations. I declare this conference duly opened. I thank you. Over to you, Madam.
Thank you very much, Dr. Nyashanu, for those very enlightening remarks. At this moment, honorable members and distinguished participants, allow me to call upon Ms. Delight Moyo from ActionAid Zimbabwe to give a background on the Partnership for Social Accountability Alliance in Zimbabwe. Ms. Moyo, you have the floor, please.
Thank you very much, Madam Moderator. Please kindly confirm you can hear me well.
We can hear you, but I'm not able to see you.
We can hear you and we can see you.
Thank you very much. Thank you.
Okay. Thank you very much for the flow, and to honorable members here present and all protocols observed. Thank you for this unique opportunity for us to present as ActionAid Zimbabwe, and in particular as the Partnership for Social Accountability Alliance Consortium here in Zimbabwe. So if you would allow me, I have a presentation and I would like to share the screen while I'm presenting, if that's okay.
That is fine, Ms. Moyo.
Okay, it seems I do not have the rights yet to share.
Colleagues, the ICT team, kindly assist Ms. Moyo to share her presentation.
You can share now.
Okay, thank you.
Please kindly confirm to me if you can now see the presentation, Madam Moderator.
Yes, please, we're seeing your presentation. You can go ahead.
Okay, thank you very much. Once again, thank you for this opportunity to present. I will give a brief background on the strengthening social accountability and oversight in health and agriculture in Zimbabwe, which we call the Partnership for Social Accountability Alliance project. So the goal of the project is to ensure improved accountability and gender responsiveness in public service management, particularly in the areas of HIV, sexual and reproductive health services for adolescents and youth, and agricultural services for smallholder farmers. And this contributes to the realization of selected SADC regional commitments across 5 countries, that is Malawi, Mozambique, Zambia, and Zimbabwe. So where does the project work? So the project works at a regional level. As you are aware of the May meeting that you had with other regional consortium members, which includes Action Aid, the Public Service Monitor, East and Southern Africa Farmers Forum. And then we come next to the national level, and here in particular, Zimbabwe. And in Zimbabwe, we are working both at national and district level. And district level, which is our local level, we are working within Binga and Mutokos district. So as a project, we have a theory of change that we are working towards realizing. And this theory of change reflects the work that we are doing at district and national level, as well as regional level. So through strengthened capacity in social accountability monitoring and in public resources management, we envisage that this would enable more efficient engagement and collaboration, that is between national institutions and the community or the citizens whom we are working with. And here we also envision that a shift or shifting power within the different regions where power lies will enable enhanced public resources. And this will result in delivery of quality public services within agriculture and health. And while we adhere to ensuring that we hold duty bearers accountable to national level commitments that are made, we also ensure that there is a realization of regional commitments that the country is signatory to. And hopefully this will lead to improved food security and sexual and reproductive health within the SADC region. So in Zimbabwe, we are working as a consortium, as earlier on alluded to, with the Swiss Agency for Development and Cooperation, SDC, being the funding partner. We have Action Aid Zimbabwe being the lead and coordinating partner. We have SAFAIDS, who are leading on the health component. Then we have the Zimbabwe Small Organic Farmers Forum, leading on the food security component. And lastly, we are working together with the Southern African Parliamentary Support Trust, who are a consulting partner, helping with linkages with Parliament. So as Zimbabwe, we have an advocacy strategy that we are currently working towards, both within food security and sexual and reproductive health. So under food security, the main problem that the project seeks to address is vulnerability to weather-related shocks in the agricultural sector, as well as lack of local information centers to educate smallholder farmers on climate change and adaptation. And here the public resource management challenges that as a project we've found include that agriculture is not adequately financed. There is lack of specific climate interventions. Also, smallholder farmers are not consulted or prioritized during budget processes. Then lastly, no comprehensive specific national policy or legislative framework for climate change adaptation is currently available. So the advocacy goal here, owing to the problems that have been raised, include increased resource allocation towards water harvesting innovations by smallholder farmers in a bid to address climate change, as well as increased financial resources and investments on agroecology and community systems, which would address disaster risk preparedness plans and education to farmers through extension services. And so we have targeted messages to the various stakeholders that we are working with. And the project is working with 5 key stakeholders, which includes Parliament and local government authorities, district authorities, civil society, medium, smallholder farmers, as well as young people. So the targeted messages towards Parliament and councillors is for committees of agriculture to ensure increased budgetary allocations to agriculture, and as well as adequately consult smallholder farmers in budget making and policy formulation processes. At district level, the project involves smallholder farmers in planning and implementation of programs, particularly during the budget process. Recognize linkages between vulnerability to weather-related shocks in planning, resource allocation, and implementation. And lastly, to ministries of health and finance, the targeted message is to address issues raised by smallholder farmers through allocations and policy change. And our interventions have included the adoption and localization of a social accountability monitoring curriculum and training of stakeholders whom I earlier on indicated, such as smallholder farmers, young people, local councillors, parliamentarians, civil society, on social accountability monitoring at both district and national level, as well as establishing or capacity building of smallholder farmer committees as they carry out social accountability monitoring through community scorecards. Lastly, the interventions also include policy briefs, budget analysis, and position papers that developed by smallholder farmers and young people on budget analysis and social accountability findings. Then on, as well as district level stakeholder meetings, advocacy meetings, and engaging medium. I move over to the sexual and reproductive health rights problem. So as a country, the problem that we are accessing is poor access to comprehensive youth-friendly sexual and reproductive services, especially in primary health facilities. the project is also looking to address limited domestic resources for family planning, resulting in high user fees on family planning commodities or products. And the public resource management challenges that we've found are inadequate budgetary allocations and disbursements to the National Family Planning Program, limited data or information on domestic sexual and reproductive health spending. And also there is very limited consultations with young people at the planning stages. And largely the centralization of the health service fund is posing a challenge towards adequate sexual and reproductive health services. So, and here our goal is to ensure that the national health budget allocation is increased to 15%, while it is commendable that in the 2020 national budget, the health allocation received a vote of more than 13%. It would be ideal to increase it to the recommended 15% as per the Abuja Declaration, as well as to ensure that 3% of the health vote is fenced for sexual and reproductive health rights by 2023. And this will be done through consultations with young people, and including adolescent girls and young women, as well as young boys. As a project, we'll also be working with, councillors, the parliament, to conduct inclusive public hearings, lobby for necessary budgetary allocations required for domestic financing of the National Family Planning Project, as well as with the Ministry of Health for improved provision of comprehensive sexual and reproductive health services, particularly youth-friendly services. And some of the interventions that we have done, just like in the food security component, there has been the adaptation and localization of the social accountability monitoring curriculum and the training of stakeholder groups at district level. There's been the establishment and capacity building of, of advocacy groups with adolescent girls and young women. And also there is advocacy towards ensuring their involvement within health center committees. In a nutshell, this is the advocacy strategy that the project seeks to address both at national level and district level in Zimbabwe. I'll move over to some of the key highlights we have realized since the inception of the project in 2019. At national level, we've developed a public resource management map which tracks resources from planning to expenditure stage. And this has been used in the capacity building sessions that we have. As a result of this, a community of practice platform has been created to understand the public resource management system in agriculture and health, both at national and district level in Zimbabwe. And some of the stakeholders include the Office of the Auditor General, Parliament Budget Office, Ministry of Health and Agriculture, as well as civil society organizations. Under food security, the key highlights that we've realized as a consortium include the establishment of social accountability committees in Motoko districts, which are made up of 28 individuals, these smallholder farmers. There have been social contracts between councillors and smallholder farmers developed to monitor gaps identified in provision of extension services in 3 wards of Mutoko. The gaps were identified during the administration of community scorecards in 2020. Increased participation by smallholder farmers and social accountability monitoring committees in the national budget processes through meetings with the Parliament Budget Office and Portfolio Committee on Agriculture has resulted in a position paper to influence extension services that address agroecology principles being developed and submitted to the ministry. Then there's been wider stakeholder engagement and support from the district administrator in Mutoko Rural District Council, the Agri-Tax, and all this has resulted in the success of the social accountability monitoring curriculum mapping exercise, as well as the adoption of a local curriculum. Under sexual and reproductive health rights, some of the key highlights that we've realized as a consortium include the successful establishment of ward-level advocacy groups in 2 implementing wards in Binga to enhance increased participation of young people. These groups consist of adolescent girls and young women, adolescent boys and young men, as well as health center committee members. And the groups have been participating in budget monitoring activities, as well as public resources management initiatives. And they have shared recommendations to influence key priorities in health financing at district and national level. And this has been seen through improved collaboration amongst Binga district stakeholders, such as the Zimbabwe National Family Planning Council and the Ministry of Health. These stakeholders have committed to the revitalization and strengthening the capacity of health center committees. Health center committees are mandated by the Public Health Act to support local healthcare planning activities, including resource mobilization. As such, as a project, we are advocating for the revitalization of these committees, as they will play a critical role in ensuring that local health centers are adequately resourced to offer sexual and reproductive health services. Lastly, as a result of social accountability monitoring through community scorecards in 2020, 2 rooms have been availed by the nurses in charge to be used as youth-friendly corners at Siansundu and Simatelele clinics in Binga. So the part of the main goal, as alluded to earlier on, is to ensure that health and agricultural services are gender responsive. And so we have voices from community members that we gathered during the different capacity building sessions on what a gender responsive agricultural public service will look like for a female smallholder. And here we have one of the voices on number 1 indicating that on land and financing, I would like to have equal access to owning land relative to my capacity as a young farmer, and having access to microloans with reasonable conditions suited for young farmers. We have another farmer who indicated that agricultural extension inputs that they would like to appreciate technical and practical support they are getting, but however, they would need practical support to be specific to organic farming processes. And the third voice indicating that knowing the statistical household, for example, if a house is female or child-headed, this would help in ensuring that the needs or input support towards planning are relevant to the needs of a particular farmer. And lastly, investments in inputs and services that will ease my load as a female farmer. For example, innovation water harvesting techniques, irrigation system, fencing, post-harvest loss prevention, household seed banks would save me time and increase my efficiency. On the sexual and reproductive health component, apologies, my slide is not very clear there, so I will just read through it, but these are some of the views shared by young people. With regards to decision-making, proactively seek out a community female and male young person voice on sexual and reproductive rights in decision-making platforms, such as the budget at village, ward, district, and national level. This way we can shape the sexual and reproductive health services to fit our experiences as users. Regularly share and justify the decisions made to us so that I understand why the situation is the way it is. Then lastly, on creating safe spaces, the health facility must be a safe haven, a space where safe sexual reproductive commodities are available when needed. Make facilities and health staff available, and secondly, non-discrimination and being youth-friendly. Reach me and be my guide as I grow. Recapacitate and utilize community health workers, village health workers, family planning distributors to reach me and provide me age-appropriate sexual and reproductive health services. Another young person shared that, put your money where your mouth is. For me to access comprehensive sexual reproductive health information, the youth-friendly services personnel needs to be in place. A place has to be created, the information has to be available, and all of the needs. We would like to see progressive investments towards sexual and reproductive health in the national health budget, and largely opportunities for livelihoods. Fill me with age-appropriate sexual reproductive information and capacitate me on realistic and sustainable income-generating projects. So these are some of the voices that we recorded during our trainings on the type of services young people and farmers would like to see or would like the service that they are getting to progress towards. Moving on, lastly, as a project, we have lessons that we've learned in the last 2 years. We have been applying public resource management approaches. And one of these is, it is important to build relationships across stakeholders. And these are stakeholders at district and national level, so as to understand accountability in its context. Lastly, a flexible and adaptive approach is necessary because of the dynamic nature of public resource management system. This is where my presentation ends. Thank you, Siyabonga Tatenda. Over to you, Madam Moderator.
Thank you very much, Ms. Delight Moyo, for that background on the Partnership for Social Accountability, and also for the work that you are doing in terms of social accountability in the health and agriculture sector in Zimbabwe. We are grateful for that presentation. Allow me now to give the floor to Mr. Pepukai Chivori, the Director, Parliament Business Office in Zimbabwe. He's going to make a presentation on understanding social accountability in the context of SADC commitments. Mr. Chivori, sir, you have the floor.
Thank you. Thank you very much. Let me just ride on the already established protocols and say all protocol observed and move straight into my presentation. If you allow me to share a screen. Right, I'm sure everyone can see my screen. So I'm going to present on the social accountability in the context of our SADC commitments. And in that presentation, we'll define what accountability is, the background to social accountability. Then we'll also try to link it to the PSAM social accountability approach. Then we'll also look at the rights-based approach to social accountability monitoring, the UN International Human Rights Treaties, then regional commitments on health and agriculture, then link them to the social accountability system. Then we conclude and also look at some of the factors that we can consider. The definition of accountability as given by Odo in 2015 is that it's a principal-agent relationship where the agent is accountable and has to explain and justify his or her action to the principal who may impose sanctions if the explanation is found to be lacking. So in a principal-agent relationship, the agent has to explain, the agent has to justify and take corrective action, failure of which the principal will sanction. And in that relationship, it builds on collective efforts of the citizens and civil society organizations to hold public officials and service providers and government to account for their obligations. And in that engagement, the aim really is to stimulate demand from citizens. If citizens are given information, if citizens know what is expected from the duty bearer, then they will put pressure on the state to meet its obligations and to provide service to the citizens. So that's the whole approach in social accountability. And it encompasses 4 key elements, which include your setting of the standard of performance. For example, you are saying in terms of health, this is what we want to achieve. Or you may say this is per capita allocation to health that we want to achieve. Then you get as much information as possible about the action that need to be taken to achieve those standards. Then you also make your judgments about the appropriateness of those actions. Then if any action is found to be lacking, or if there is unsatisfactory performance, then you sanction. So the PSAM social accountability approach was built from this definition, PSAM Public Social Accountability Monitor. It was built from this background and founded on the basic premise that all human beings have equal dignity and an equal claim on the resources required to meet their basic human rights. So they grounded this PSAM social accountability monitoring approach on the human rights framework, which uses evidence produced by public resource management process to identify the systemic weaknesses in public resource management. So you take the state, you convert the state into a social accountability system, and the state is then assigned a role of delivering the services to the citizens that address their basic human needs. And based on that principle, what we want to see is a progressive realization of the rights. We have the right to health, you have the right to food. But what we want to see is the progressive realization within available resources, where the life that someone lives tomorrow should be better than the life that someone lived today. Which means if the health outcomes that we achieved in 2020 reached a certain level, we expect an improvement in 2021 in terms of the outcomes. We don't expect to be going down. So in this human rights-based approach for social accountability monitor, like I said, we begin from the premise that all human beings have a basic set of needs. Then you then transform the state beyond merely acknowledging citizens' rights, but the state has to recognize them as entitlements. If the state recognizes people's rights as entitlements, then it means that state will then implement all these regional protocols and regional commitments with a very clear mind that we are doing this so that we make sure that our people will meet their basic human rights, which we are not only acknowledging, but we are recognizing as entitlements to capabilities. So you transform the state into a social accountability system. So that is truly responsive to the needs and the capabilities of its people. And the state must take all the necessary steps, all the institutions of the state must take all the necessary steps, be it legislative, be it budgeting, be it incorporation of these regional commitments into domestic legislation, all the necessary steps within the available resources. And the citizens should not be treated as passive users of public resources, but they are active holders of fundamental basic rights. So which means the citizens, by voting a government into power, they are mandating their government to govern for the people and manage public resources on behalf of the people. And the citizens have the right to demand justifications and explanation from the state when it fails to provide the adequate services. So that's the whole essence about the public social accountability monitor, or the rights-based approach to social accountability, where you transform the state into a social accountability system, and where the state approaches service delivery from a human rights perspective to say we want to fulfill the human rights. And these human rights are derived from the UN charters and the UN human rights framework, where a human right is defined as a universal legal guarantee protecting individuals and groups against actions and omissions that interfere with fundamental freedoms, entitlements, and human dignity. So that's the UN definition of a human right. So it bestows entitlements on the rights holders and imposes obligations on the state, and the state in this case is the duty bearer or is the agent, while the citizens are the rights holders or the principals. I will not speak about the 7 core UN International Human Rights, but I will expound further on the International Covenant on Economic, Social, and Cultural Rights, just as an example, to say in this covenant, you see, we have the right to health. We talk about social security. We talk about education. We talk about continuous improvement of living conditions. We talk about adequate standard of living, including food, clothing, and housing. And borrowing from these, our constitution in Zimbabwe also has a chapter 4, which lays the framework on people's rights. So the Bill of Rights in chapter 4, specifically chapter 7, section 77 speaks on the right to food and water. Your section 76 speaks on the right to health care. So section 72, rights to agricultural land. So this is part of the discussion today. So what we have committed ourselves to as a country, as a nation, in terms of implementation, all stems from what the Constitution says. So in agreeing or in committing ourselves as a country to implement some of these regional commitments, we were guided by what our Constitution says in terms of the respect to these human rights. For example, looking at the constitutional provision with regards to health, you realize that every citizen, the Constitution provides that every citizen and permanent resident of Zimbabwe has the right to have access to basic health care services, including reproductive health care services. So when we then commit to the Abuja declaration of 15%, it's an avenue or it's a commitment that we are making, fully aware that if we allocate at least 15% of our budget to health, then at least we are moving closer to making sure that we realize or our people realize this right to health as enshrined in the Constitution. So every person with a living chronic illness has the right to have access to basic healthcare services for the illness, and no person may be refused emergency medical treatment in any healthcare institution, and the state must make reasonable legislative and other measures within the limit of its resources to achieve the progressive realization of the rights that are set out in the Constitution. Then looking at the right to land, very clear in section 72, and also we have a whole chapter 16, that speaks about the rights to agricultural land. You also have a section 289, which speaks on the use of agricultural land, which should promote food security. We also have a section 77, which speaks to the right to food and water, where every person has the right to potable water and sufficient food. And the state must make reasonable legislative and other means to make sure that we achieve this. So as parliamentarians, let's make sure that the legislative framework is there, and where we have committed in terms of these regional commitments, then let's make sure that they are implemented so that we take our nation on the path to achieve what is envisaged in section 77. Then section 15 is the right to food security, where the state must encourage people to grow and store adequate food, where the state must secure the establishment of adequate food reserves and encourage and promote adequate proper nutrition through mass education and other appropriate means. So which means when we made these commitments, we were fully aware of what our Constitution says. Some of these commitments, as they relate to, say, health, this is not an exhaustive list. You have your Abuja Declaration. And in our Abuja Declaration, we tend to focus only on the allocation to health, which should be at least 15%. But there are other issues that are in that declaration which relate to also donor countries to help by assigning 0.7% of their GNP as official development assistance, which also relate to availability of affordable drugs. So we have committed to avail affordable drugs. So beyond the 15%, let's ensure that we also implement the provisions of this declaration in as far as affordability of drugs is concerned, as well as exploring the potential of traditional medicines and traditional health practitioners. In Zimbabwe, we have seen the traditional medicines really hogging the limelight in the recent months due to the unavailability of some drugs, and also some of the drugs being expensive for the ordinary citizens who have then resorted to these traditional medicines. And we have now incorporated a program within the Ministry of Health budget, which speaks to the need to revitalize our pharmaceutical industry, as well as explore the traditional medicines scientifically. And the Abuja Declaration also speaks on scaling up the role of education and information in reducing HIV and AIDS. There's also the strategy for SRHR in the SADC region, which runs from 2019 to 2030, Maputo Plan of Action, which speaks on the operationalization of SRHR, the 2030 Agenda, and Agenda 2063. This program that we are discussing today is looking at investments and spending on adolescent HIV and the SRHR services. It's also looking at provision and utilization of comprehensive HIV and SRHR services, which then relate to the commitments that we have made, to make sure that if we just implement what we have committed to, then everything that is on this slide will have been achieved. Prioritization of planning for HIV and SRHR services. Then with regards to agriculture, in no particular order, and it's not exhaustive, there's the SADC Regional Agricultural Policy, the SADC Regional Indicative Strategic Plan, Protocol on Trade, Protocol on Fisheries, Protocol on Forestry, Wildlife Conservation, Seed Policy, Protocol on Gender and Development. Both this addresses the challenges which are faced by women and smallholder farmers. So it's a very important protocol in as far as agriculture is concerned. There is also the protocol on transport, communication, and meteorology, because meteorology forms basics in terms of making sure that we receive adequate rainfall to support our agriculture. Water policy, industrialization policy, sugar protocol. Then in the African Union, you have your AU, NEPAD, you have your CADIP, you have your Maputo Declaration, which was reaffirmed in Malawi in 2014, where we made a commitment to allocate at least 10% of our budget towards agriculture and rural development. Then there's the food nutrition security strategy, among other strategies. So what we are saying is the rights that are enshrined in the UN Charter were adopted in our constitution. And then our constitution then informed our decision to also be part of these regional protocols as we try to make sure that we implement what our constitution says in the Bill of Rights. And we have an obligation to respect and to take any measures that result in preventing access to the right. And we have the obligation to protect as a nation, where we have to ensure that enterprise or individuals do not deprive other individuals of their access to the right to health or to agriculture, to adequate food. Then we need to fulfill by facilitating means we must proactively engage in activities intended to strengthen people's access to and the utilization of the resources. But you need to realize that having a right is not the same as in having access to that right. We may have rights, but it's the role as honorable members to make sure that we have access to that right. So we, as citizens, we should not take them as passive users of public services. We should look at them as active holders of fundamental basic rights. So this is what the social accountability system says. If you have a right to something that you don't deserve, rather than something that you actually have, for example, the right to health versus access to health care. You have the right to health, but we need to make sure that our people have access to right to health care. So we need then to make sure that they are capable of receiving that health care. So we transform the right into a capability or an entitlement so that people are able and have the freedom to enjoy that basic right. How can we do that? If we domesticate some of these protocols, then we are also converting these into capabilities so that our people are also able to enjoy these rights. I will not speak about the Bill of Rights. I've spoken much about the Bill of Rights, but giving an example of the right to healthcare, I will just pick the right to healthcare. We need to make sure that health is available. Do our public healthcare facilities, are they in existence? And are they sufficient? Do we have healthcare facilities in every ward? Do our people have access to safe drinking water, adequate sanitation, hospitals, clinics? So it's about availability. Beyond availability, we also need to look at accessibility. It should be accessible, physically and economically affordable. And it should be provided to all on a non-discrimination basis. And information on how to obtain this should be freely available. People should know, if I want access to SRA issues, what do I do? If I want access to maternal health care, what do I do? If I want contraceptives, what do I do? Information should be free for all. Then another issue is on affordability, where healthcare must not be priced beyond the means of the less privileged. Then we look at acceptability. There must be some respectful people should abide by some of the ethics that are expected within a given spectrum. Then we also look at quality. So this was just an example of using the social accountability approach in the access to healthcare. So with regards to access to healthcare, there is or access to agricultural land or the protocols that we have also signed. One important element is access to information. And access to information is a fundamental human right. because it allows people to scrutinize the actions of their government and is the basis for informed debate of those actions. People know of the Abuja, but they need to know other elements within that Abuja declaration beyond only allocating 15% to healthcare. People need to know what the Maputo declaration says and all other declarations that we have committed to as a country. So we need to give people information, and people need to know why allocating 15% to healthcare is good for the country and is good for their welfare and in ensuring that they meet their rights. And armed with that information, then citizens can engage duty bearers on an evidence-based framework so that they participate proactively and effectively in governance process. Because when armed with information, then they can confront government from an informed point of view. Because this information will help them in understanding their rights, their responsibilities, because citizens have a responsibility. So they will need to know what also is expected of them in terms of assisting the government to meet these commitments. And also, I quote Stabrook News, which said, if either relevant information remains concealed or the rules governing access are weak, the monitoring function of the citizens is thwarted and the corrupt will be emboldened. So which means we need to give people information. Civil society must look for information, must have information. Our citizens must be given information. And it is the duty of parliamentarians to provide that information to the citizens. Because ordinarily, you won't expect duty bearers to provide that information because they thrive if information is thwarted. So it's our responsibility as parliamentarians to provide that information. And in any case, our section 62, subsection 1 and subsection 62, subsection 2 of our constitution guarantees the human right to access to information. And this information may be any information that is held by the state or any institution or agents of government at every level by a Zimbabwean, or be it a Zimbabwean citizen or a permanent resident, in so far that information is required in the interest of public accountability and protection of a right. So which means we also need to give people information. And the social accountability system as developed by the PISAM, they've developed a framework which interrogates public resource management. And that PISAM social accountability framework allows oversight bodies, including parliament, including CSOs, including the Auditor General, to monitor and track expenditure of public resources in a more holistic manner. And this is conceptualized in 5 interlinked processes, which include the first process being planning. Let's look at the planning. Government plans or strategic plans informed by rigorous needs analysis? Are we informed by what people want out there? Then when we do expenditure management, we use the resources for things that affect the lives of our people. If we use the resources for what was approved by parliament, then if we achieved the intended resource outcomes, that's performance management. If we achieved what we intended to achieve, because it's one thing to allocate 15%, but it's another to achieve what you want to achieve. So we need to monitor. That's where oversight comes into the fore. So that we monitor government expenditure, we monitor government activities to make sure that we achieve what we want to achieve. But where we realize that there are inconsistencies, then public integrity management comes to the fore, where we correct any action that is contrary or that inhibits us from achieving what we want to achieve. At the end of the process, we do oversight, where we check whether we are transparent enough, whether we are giving people information, and whether we have used the monies for the intended purposes. So that's the whole essence of the 5 processes in the social accountability approach. So these are the processes in the social accountability approach. But let me hasten to point out that any weakness in one part will have a knock-on effect on all the other processes, resulting in the weakness of the overall system. So it's a chronological sequence. We need adequate and foresighted planning and resource allocation. We need to effectively use public funds. We need to make sure that we are implementing their plans according to what was the intention. And we need to make sure that we have mechanisms to prevent and take corrective action where the response to or where there's a misuse of resources. And the service providers should be called to account by the oversight agencies, which include the Auditor General. So in everything that we do, let's look at the priority. Are we prioritizing our allocations in a manner that reflects its human rights obligations and commitments? So when we receive, as parliamentarians say, we receive a budget, have we prioritized the allocations in a manner that speaks to our commitments, regional commitments? Have we done that? Then we look at adequacy, we verify the allocations. Are they sufficient and in line with our regional commitments? We have committed. So we also need to scrutinize whether we are doing what we have committed to. Then we also check progress, whether we are making sufficient progress in meeting our obligations over time. We also look at issues of equity, where we evaluate if citizens are benefiting equally from social accountability programs, and we look at compliance, whether our country is compliant to the Constitution, to the public finance management, to international and regional protocols and declarations or commitments that we've made, including but not limited to Maputo Declaration, to the Abuja Declaration, and other protocols. So at the end of it, then the oversight function of Parliament also comes to the fore. And that oversight stems from a constitutional provision under Section 299, where we are expected to have oversight on all institutions. And that oversight is mainly to provide checks and balances in the management of public resources. And the power holders or office bearers, if they are left on their own volition, they are prone to abuse of office or power. So oversight is an overarching process in all the 5 processes that we have discussed, where we are seeking explanations and justification from both the supply side and the demand side as parliamentarians. And we make sure that remedial action are taken where contrary behavior is found. And the state and the non-state players are brought together. These include legislatures, supreme decisions, CSOs. We bring them together so that we achieve what we have set ourselves to achieve. And in that, we need to consider the following. Sorry, just a moment. I'm running out of battery. Thank you. I was running out of battery. So the factors that we need to consider in this accountability approach and in our oversight role as parliamentarians, let's look at the legal framework and let's look at the commitments that we have made. Does our legal framework also speak to the commitments that we have made, or have we domesticated those commitments into our own domestic legal framework? Then we look at the capacity and independence of the oversight bodies, including Parliament. Do we have the capacity? If not, then we need to build that oversight capacity within these oversight bodies. And we need to ensure that they are as independent as possible so that we take these issues from a very professional point of view. Are we allocating enough resources to meet what we've intended to achieve? Well, some of these commitments, they entail or they need the resources for us to be able to abide by them. So some of these commitments, you really need to allocate adequate resources for us to achieve that. Do we also have the political will to achieve this? And it's the role of Parliament to make sure that that political will is there, be it from an oversight point of view or from a legislative point of view, but we also need to make sure that we have the political will. Then most importantly, are people, do our people have information? Is there access to information, very critical information that allows them then to know what is happening in agriculture and what are they entitled in as far as agriculture is concerned? What are they entitled to in as far as health is concerned? And that information needs to be available in user-friendly formats, be it for the little girls in our communities, be it for the disabled. So we need to create information formats that are user-friendly for the people so that when people get that information, they develop that demand conscience that ultimately put a pressure on the duty bearers to deliver. Then we also need to make sure that in everything we do, we consult. Every stage we need to consult the citizens so that we keep them in the loop and we are implementing what the people are really saying in terms of their priorities. So with that, we would have achieved the social accountability approach. So in conclusion, the social accountability monetary framework, for it ensures that there is effective, efficient, and economical utilization of public resources. And this framework enhances social inclusion in public resource management. And it helps to channel public resources towards meeting citizens' rights or basic human needs. It also helps to identify systemic weaknesses in public resource management system and timely corrective actions. So in conclusion, honorable members, what I've been saying, what I've been preaching in the last 15 or so minutes is that let's utilize the social accountability system where we begin from the premise of basic human rights, which are also enshrined in our Bill of Rights in Chapter 4. Then from that premise, there are some commitments that we have made to the region. Let's make sure that we domesticate some of the commitments, and we also, therefore, also form part of the domestic legislation. Then through our power of the purse, let's ensure that adequate resources are allocated towards ensuring that those commitments are fulfilled. And it's only, it's not enough to allocate enough resources, but it's also a requirement that we monitor the use of those resources to make sure that we achieve the intended outcomes. And having achieved the intended outcomes, we need to make sure that we have systems in place to monitor ineffective use of resources and also to put corrective action. For example, if there's abuse of resources, do we have enough guidelines on what to do? Then all institutions must account to the Supreme Audit Institution at the end of the day. Once we do that, then we are ensuring that we are meeting some of the obligations that we have committed ourselves to. So in essence, that's the Public Service Accountability Monitor or the social accountability approach to these regional commitments. Back to the chair. Thank you very much.
Thank you very much, Mr. Chivore, for that presentation. Honorable members and distinguished participants, with your permission, I would like to propose that all the presentations are made and then questions can come after that. In that regard, if it's agreeable, I'll request honorable members to just take note of the questions or any points of clarifications, and then they can do so during the question and discussion session. I seek your permission.
I second you, Anirongo.
Thank you, Honorable. Thank you so much, Honorable members. May I now call upon Ms. Elizabeth Mpofu, the founding chairperson for Zimbabwe Smallholder Organic Farmers Forum, to give a presentation on the SADC commitments on agriculture and food security. Ms. Mpofu, please, you can go ahead.
Thank you, Chair. All protocol observed. Briefly, I just want to say this is a great opportunity for us to be invited in this meeting so that our voice as small-scale farmers and the women farmers is heard. I want to send my gratitude to the organizers of this meeting, especially the SADC PF and also the consortium through Action Aid, which is playing a very big role in bringing us together as small-scale farmers. I'm going to present to you the SADC commitments on agriculture and food security. I'll begin with the context where we are very much aware that agriculture is a major economic activity for most SADC member countries, which provides employment, trade opportunities, food and income to almost around 70% of the region's population. And the performance of the sector is also closely linked to the economic development, food security, and stability. In SADC region, there's no one who can argue with me that agriculture has a special and important place in the society because it ensures the production of food and fiber, which is essential to food security and to social and economic development, employment, maintenance of the countryside, and conservation of land and natural resources, and helping sustain the rural life and land. Many households in the SADC region are perpetually experiencing insufficient food of acceptable quality and nutritional level. The dynamics of food security at this level are becoming complicated. This, we are also getting them from the readings we go through that this is the situation in our region. However, investment in agriculture, such as improved irrigation and drought-tolerant crops, have proved to reduce food prices and income variability. Coming to the issue of the COVID-19, which has amplified the need for SADC and its member states to build block better through creating more resilient, inclusive, and socially accountable nations and communities in the wake of disasters. The global economic downturn, the heavy burden of debt, the diversion of budgets and the personnel to respond to the crisis, and the effect of the restrictions themselves have affected the delivery of public services in many sectors, including agriculture. There's also corruption and the misuse of public funds, as widely reported in the media, which has also undermined the effectiveness of the COVID-19 response and placed further pressure on existing services. Honorable members, I'm just going to talk now about the social accountability challenges in the service delivery. Planning and resource allocation is suffering from lack of consultation, resulting in priorities of smallholder farmers being excluded from the process. As smallholder farmers, we believe in meaningful participation of smallholder farmers, especially women, and the devolution of powers to local levels. At the regional level, consultation with the relevant stakeholders is still more ad hoc. This is limited. We are not really informed or consulted or even invited to participate in these processes. So the institutionalization of inclusive SADC national committees in each SADC member state is an opportunity that can also improve local participation. We look at the Malabo Declaration, which is still far from being reached by many SADC countries that also are still failing to achieve the targeted agricultural growth of 6% per annum. As a result, important projects such as irrigation schemes, markets, and processing plants are in some instances stalled. What do we think is the role of the national parliaments? The national parliaments should play an important oversight role in ensuring national governments remain committed to critically interrogating the content of regional commitments, domesticating them appropriately within their national laws and policies, and implementing programs in line with their objectives. Importantly, parliaments should ensure governments are adequately tracking and reporting on progress against indicators and adjusting their plans as necessary. With this short presentation, I really want to thank you all for your time and also for listening to a voice of a smallholder farmer who is really struggling to achieve food security, food sovereignty. And I hope this meeting is also going to build on to what the farmers are saying. Thank you.
Thank you very much, Ms. Pofu, for that beautiful presentation, where you highlighted the need for parliaments to domesticate regional commitments to enhance social accountability in respective countries. At this moment, I would like to call upon Mr. Nelson Muzingwa, the National Coordinator of Zimbabwe Smallholder Organic Farmers Forum, to make a presentation on social accountability gaps in agricultural services. Mr. Muzingwa, you can take the floor.
Thank you, Madam Moderator. All protocols observed. Let me try to share my screen, then I can follow through my presentation. Can you see my screen now?
Yes, please, we are able to see the screen. You can go ahead.
Thank you very much. Just to start with, I will speak from a farmer's point of view because I'm also a smallholder farmer, though I'm a national coordinator for ZIMSO, but I'm one of those who are, like Madam Pofu has talked about, who are actually sidelined when it comes to decision making and when it comes to the issues that have to do with farmers. On all my slides, I've tried to show some pictures. I think you can see those pictures. The one on top is actually talking about water. Right now, we are having quite a lot of challenges that are as a result of climate change. And as farmers, we've developed so much local solutions which can help, which can make agriculture more productive even when the rains are not there. But such experiences and practices are not considered. The voice of the farmer is not listened to. I've also tried to put a photo with diverse local seed varieties that farmers are keeping at their households, where there's this issue to save and reuse local seed varieties, those food crops that we've ever been growing for quite some time, but many of these are just beginning to disappear, and the voice of the farmer again on that matter on local seed saving is not being considered. Then the last picture is when we are talking about food forests. You can see the short man right in the forest, in the food forest, growing lots of different food crops, covering the soil, making sure that at least a lot of water is being harvested at local level, but all that effort from the farmers is not being considered. Then if you look at the context where the farmers are now surviving right now, you can see that we appreciate very much that our agriculture in Zimbabwe is the potential to contribute to 15 to 20% of the gross domestic product, and providing actually food to over 70% of the population if suppose we integrate all the diverse food crops that Zimbabwe is able to produce from all local seed varieties. Then we have the issue of climate change, with the issue of loss of biodiversity and declining soil fertility, which are critically damaging the health of the people. And this is actually affecting in particular the youth. You find the youth actually migrating to urban centers in search of employment and leaving agriculture as a job for the elders. But yet these are the energy people who are supposed to be producing as much food as possible. You would also see that from 2000 to 2020, as a result of this climate change, productivity actually dropped very much, especially in maize and wheat and other cereal crops, which has compromised the national and household food and nutrition security. However, we have seen productivity increasing in 2020 to 21 season as a result of the good rains that we recorded. We have also noted the effect of COVID-19 on us as smallholder farmers, especially many of us who actually live in the countryside. As a result of limited movement, we had to suffer very much as factors of reaching out to the market were actually blocked. So if going back to the to the social accountability gaps, major constraints affecting the smallholder farmers include the following. We have limited access to market information. Sometimes you find as farmers, we end up growing what we don't eat and eating what we are not growing as a result of lack of information, which is very important and very necessary for us to be informed on time such that we can reach to the market. We have also unreliable supply of inputs. We sometimes receive very wrong inputs. We can receive very long season maize varieties when you are actually staying in a region where there is very limited rainfall. And sometimes also have lack of agricultural financing. We actually produce from our own resources. Agricultural financing has ever been a very big challenge for us in the agricultural sector, especially as from 2000 until to date. Many of our farmers actually producing from their own resources apart from the inputs that they get from government. We also have a constraint on high transportation costs due to inadequate road infrastructure. In the countryside where we live, the road network is very poor, and those with vehicles that can help us carry our produce to the market, they end up charging exorbitant prices that can be out of reach of many of us. And the last one is that vulnerability to weather-related shocks. We always suffer the issue of droughts, suffer the issues of poor rainfall, or pattern mid-season droughts, and even frost and even hail that can damage our crops. And this really can end up even reducing productivity at our own levels. We have some challenges that relates to inadequate financing, right? Short-term financing, limited and medium-term finances, where we expect maybe the finance institutions to be guaranteeing us. For us to be able to produce, we will need as much support on finances for us to meaningfully produce. And we also have high operational costs. The cost of doing business is every time going very high for a smallholder farmer like ourselves. Like, for example, the cost of producing a hectare is now above $2,000, which is out of reach of any smallholder farmer you can talk about, especially those who are in the most vulnerable groups. There's also a challenge on price distortions. Sometimes you get a price for this food crop and Sometimes there is also a middleman who is charging maybe a small, high price, and that actually affects our planning and even our organizing of how we have to work as smallholder farmers. And there is also variable inputs management, where inputs, when they are coming to us, they come very late, or sometimes when they are coming to us, they come as very wrong inputs. And we also receive limited inputs that can suffice to the area that we will want to be growing our food. And the issue of rainfall variability, I think I've mentioned it, that in some regions, and as the climate change is affecting us, we are always having droughts, mid-season droughts coming and affecting our productivity. And there is any project or any program that is focusing on building a lot of resilience onto the smallholder farmers. And there is that observation to see what farmers are doing on the ground and linking the voice of the farmer and the experiences of the farmer, at least to counter the variability of our rainfall pattern. Then the last one is inadequate investment in production, including inadequate irrigation infrastructure and water points, and high and huge post-harvest losses. What do we think could be, we believe could ensure Zimbabwe at least to achieve food security? To us, we refer this as food sovereignty, where we want to believe that the farmer is supposed to control what he's supposed to produce, and the farmer is supposed to control also the means of that production, and production in the sense of being very much consciousness to the ecology, and also very much conscious to the soil and water resources. We would want to include these points that at least we must have a good rainfall, which will go along with the practices that farmers could be doing on the ground, the issues of water harvesting coming on board at macro level and at micro level and at macro level, growing that from the farmer level and making water available all the season and making production to increase. We want to have access to capital, which is a very big challenge, as I have alluded to before. We want to have access to inputs that are actually relevant and affordable at our own context, and inputs that actually contribute to our food production and also contribute to our income. We want training and education that relates to the practices that already we are doing as farmers, and also training that relates to what could be very appropriate even from farmer to extension officer or farmer to farmer levels. We would want to include research and development in the line of agroecology, where we believe that our agriculture is supposed to focus very much on how the farmers are producing food, feeding the soil, harvesting water, and growing local seed varieties. And we will also want to emphasize a lot on mechanization, where we want appropriate mechanization, reaching out to the smallholder farmers and making them to increase production. And the last point being the issue of land tenure, where we need security and where we need even to borrow, we need to use our land such that it can be a security for us to be able to produce on the farm. Thank you for your listening.
Thank you very much, Mr. Mzingwa. Honorable members, may I now call upon Mr. Adolf Maveneka, Advocate Specialist from the Southern Africa AIDS Dissemination Service, SAFAIDS, from Zimbabwe, to make a presentation on such commitments on sexual, reproductive health and rights for adolescents and young people. Mr. Maveneka, please.
Thank you very much, Madam Chair. I hope you can hear me.
Yes, we can hear you, but we can't see you.
I'm trying to share my video here. It's
okay.
From this end, it's showing. I'm not sure what's happening, but from this end, it's showing it's on. But thank you again, Madam Chair, for giving us this opportunity. Earlier on, I had missed the introduction sections. So my name is Adolf Maveneke, and I am the Regional Policy and Advocacy Specialist at SAFAIDS. And all protocols observed. We are also happy to be part of this process. So my presentation is just going to be very short, and the focus on interest is just to try to pick on the SADC SR-HR commitments that have relevance or speaks to adolescents and young people, and link that to the Zimbabwean experience, or how Zimbabwe as a country has been contributing to the realization of those commitments. So I'll try to share my little screen here. I do hope the esteemed delegates can see my screen.
Yes, we are able to see the screen.
Thank you very much. So like I indicated earlier, it's just a snappy presentation to harvest some of the SADC commitments on SR-HR for adolescents and young people, and try to project where Zimbabwe is currently. What I'm going to be discussing here is not exhaustive, but just to appreciate where we are as a country and what the regional outlook is like in terms of the SR-HR commitment for adolescents and young people. So we do have this important regional instrument, which is the SADC SR-HR strategy and its scorecard. It's a 2019 to 2030 document, which within it are set 10 clear commitments, which try to identify and meet on how the region as a whole can meet the SR-HR commitments for adolescents. And it is an important document that tries to mobilize member states to fast track the realization of positive sexual and reproductive health right outcomes for especially adolescents and young people. It is a document, again, that then brings everything together to make sure that member states and non-state actors can also work in collaboration in that direction. And the scorecard to that document, the strategy, facilitates member states and non-state actors reporting. And it is one way of trying to check on our progress. And it is really very interesting that it provides for that space for member states and as well as non-state actors to check on each other and ensure that reportage is done along the scorecard. So the vision of this strategy is to ensure that all people in the SADC region do enjoy a healthy sexual and reproductive life. We have sustainable access, coverage, and quality SR-HR services, and information and education, and are all able to fully realize and exercise their SR-HR rights as an integral part to sustainable human development in the SADC region. So this is another development instrument that sits in that context to ensure that we do achieve sustainable development. And the achievement of sustainable development can never be realized when we do not commit to engage and work with adolescents and young people so that they realize their full potential in life. If anything, adolescents and young people do represent the region's demographic dividend. And in that regard, this is why the strategy, among other guiding documents at SADC level, is trying to make sure that we move as a region in that direction of us achieving sustainable human development. Then within that strategy document, I tried to pull out the 10 SR-HR commitments. And we move from the reduction of maternal mortality reduction of newborn mortality. We need to make sure that by 2030 we end HIV and AIDS. We also need to make sure that we have eliminated sexual and gender-based violence as experienced especially by women. We need to make sure that there's reduction on unplanned and unintended pregnancies and unsafe abortions in the region. And there's also needs to focus on the reduction of on the rates of teenage and adolescent pregnancies. We also need to make sure that there is universal access of SRHR services to vulnerable groups in their diversity. And health systems needs to be strengthened to respond to SRHR needs. And there is need to create an enabling environment for young people to make sexual reproductive health rights choices. And all and above all, the need and commitment to remove barriers that impede the realization of SRHR in the SADC region. So this is just a summation or snapshot on those 10 SRHR commitments as noted in the SADC SRHR strategy 2019 to 2030. So just taking stock quickly on what to those commitments. Like I said, what I'm going to be presenting here is not exhaustive, but I'll pick on two commitments. One, which is creating an enabling environment for young people to make sexual reproductive health choices. And the one, two, on the reduction of unplanned pregnancies and safe abortions. And in that regard, here is just an overview of some of the adolescent sexual reproductive health challenges in Zimbabwe. I need not spend time on this, but what is important to note in that regard is the continued existence of GBV among young women. It remains to be high. In recent times, and even now as we are gathered here, there's drug and alcohol abuse, which is very common in urban settings and the country as a whole. We also need to make mention of the prevalence of sexually transmitted infections, including HIV, among adolescents, which remains high. And a significant number of these HIV infections are occurring among those who are aged between 15 and 19 years. And again, another worrying statistics for SRHR is maternal deaths remain very high, and they are especially occurring among our young women. This is just to provide some baseline information in terms of the context where we are as a country and how, therefore, the country is making contributions in that regard. So, number one, we've got this national instrument, the National ASH Strategy 2016 to 2020, whose goal is to reduce morbidity and mortality associated with sexual and reproductive health among adolescents and young people. And within that, the strategy impact looks at improved sexual and reproductive health of adolescents and young people in Zimbabwe. If you look at that document, it is set at 3 important outcomes. Outcome 1, which looks at increased sexual and reproductive health and HIV practice among adolescents and young people. Outcome 2 looks at increased uptake of quality, youth-friendly, integrated sexual reproductive health and HIV services. And the last outcome, which focuses on strengthened protective environment for adolescents and young people. This is really very interesting as a national level strategy, which tries to ensure that there is a reduction of morbidity and mortality, which is associated with sexual and reproductive health rights matters. So this is a bit more just to highlight the framework and how that national ASH strategy is linked to that SADC commitment on unplanned pregnancies and unsafe abortions. Need to make sure that these are reduced, and it is also looked at the strategy scorecard indicator, which focuses on the proportion of population accessing integrated SR services and age, which is age and gender disaggregated. So just to explain a bit more in detail on that commitment, this takes into improve age-appropriate access to and uptake of high-quality sexual reproductive health services and commodities, including condoms, contraception, HPV vaccination, HIV counseling and testing, treatment and care, family planning, safe abortions, waste legal, post-abortion care, safe delivery, prevention of mother-to-child transmission, and other related services for young people in and out of school. The rates of unplanned pregnancies are to be reduced through these factors and information sharing education. And this just reminded me to the earlier presentation from the Parliament of Zimbabwe, the Budget Office, where access to information is very key, and the citizens are better prepared to engage when they have got access to correct and consistent information. Then another instrument at national level, which Zimbabwe has put in place to contribute to the support of the SADC-SRHR commitments, we do have the National Health Strategy, which is 2016 to 2020, whose goal is to have the highest possible level of health and quality of life for all its citizens. Very impressive in its goal and approach. And the vision is to provide, administer, coordinate, promote, and advocate for the provision of equitable, appropriate, accessible, affordable, and acceptable quality health services and care to Zimbabweans, maximizing the use of the available resources in line with the primary healthcare approach. And this tinkers very well with my brother from the Parliament of Zimbabwe Budget Office when he made mention of the fact that access to healthcare services also needs to meet all those provisions of being accessible, affordable, and acceptable. And this is what our National Health Strategy is focused on, and the Ministry of Health and other partners have been spearheading the implementation of this strategy, which in this context is set at two objectives, which is to improve the delivery platforms or entities for services and to improve the enabling environment for service delivery. Then just a further description of that commitment, the National Health Strategy, and how the country is linking that to the SADC-SRHR commitment. This is linked to the commitment on creating an enabling environment for young people to make sexual and reproductive health rights choices. And again, it's linked to the strategy scorecard indicator on the percentage reduction in HIV infections. The sum of that commitment is creating an enabling environment for adolescents and young people to make healthy sexual and reproductive choices that enhance their lives and well-being. This is through the education for all by keeping children and young people in schools, which reduces HIV risk, maternal mortality, and improves gender equality, whilst ensuring access to educational opportunities for those living with HIV or adolescents and young women who may be pregnant. This continued education will help young people make sexual reproductive health choices. And it's interesting to note how that commitment trades off with the right to education, rights through education, and rights within education, which is then very important because this is placed at the SADC level in terms of the SADC-SRHR commitments. And our country, through the National Health Strategy, has also been making frantic efforts to make that a contribution and ensure that our adolescents and young people in the fullness of time do realize their full potential in life. This just leaves me to thank all the esteemed delegates for having taken your special time to be on this platform and giving us to share also our contributions in as part and parcel of the PSI Alliance. Thank you very much, Siyabonga Tatenda Twalumba. Thank you, Madam Chair. I submit.
Thank you very much, Mr. Maveneka. Honorable members, distinguished participants, we now have our last presentation for this morning, and this is coming from Mr. Sazilina Makumbe from SAFEDS. She will make a presentation on social accountability gaps in sexual reproductive health services. Thank you.
Can I ask Adolf to stop sharing so that I can start sharing? Thank you. This is my. It's good. Sure. Oh, what's happening? Delete. You want this one? Sorry, Madam Chair, some technology challenges. Want to fill the screen?
No, you are right.
Ms. Makumbe, are you having any challenges?
Can you just click on the last button? The
Yes,
three
we're
dots?
trying to resolve though.
You can click on the three dots. Then.
I will be presenting shortly, Madam Chair.
Thank you very much.
Then you can click on the three dots and click on hide presenter's view.
That's fine, but what it be? Because I can't read. Just a bit big. Delight, where are the people, the owners of the computer? Okay, that's fine, but I can't see, unfortunately, when it's small. Yes.
Please click on the three dots. The last button.
When they click three dots, okay.
Yeah, and then you click on hide presenter's view. Hide presenter view. The second, yes, that one. Hide presenter. Yes, you click on hide presenter view. Yes.
Okay, thank you very much. Sorry for the slight delay. My name has been introduced as Lina Makumbe from Surface, a colleague to Adolf. I'm going to be presenting on the gaps on social accountability, on a social accountability program which we are running in Binga. Binga is about 900 kilometers from here, but we have a sample of young people sitting here with us. All protocols observed. So maybe we can just recap what is sexual reproductive health rights. The right to sexual and reproductive health entails a set of freedoms and entitlements. The freedoms include the right to make free and responsible decisions and choices, free of violence, free of coercion, free of discrimination. regarding matters concerning one's body and sexual and reproductive health. The entitlements include unhindered access to a whole range of health facilities, goods, services, and information, which ensure all people enjoy fully the right to sexual and reproductive health. And I think the previous speakers have also alluded to this. And what is the current context of SRH in Zimbabwe amongst adolescents and young people? We should all know that the young people should be in charge of their sexual reproductive health rights so that they can make an informed choice and improve their health and well-being. And Zimbabwe as a country is committed to promoting achievement of sustainable development goal number 3 on good health and well-being, as well as SDG 5 on gender equality. And then I've got a range of statistics on the context so that people can really understand what it means to be an adolescent and young person in Zimbabwe. 60% of the Zimbabwean population is below 25 years, who are the young people. And already Adolf alluded that this is our demographic dividend. They are our jewel, we need to look after them. And we begin by looking after their SRH issues. And according to the UNFPA, it estimates 10% of its girls in the region are married by age of 15, and 22% of adolescent females aged between 15 and 19 have already begun childbearing. And this comes with a lot of complications because the body is not yet ready for that. Complications from pregnancy and childbirth are leading cause of death among girls aged 15 to 19 years. So a lot of mortality within Zimbabwe actually is also accounted by those young people who are not yet ready to deliver. And then moving to family planning, which we said was one of the advocacy issues which we are looking at Binga, the unmet need for family planning among sexually active young women aged 15 to 19 is higher than that of the national average. 12.6, yet national average is 10.4. And then among the many barriers to sexual and reproductive health services for young people are legal and policy constraints related to the age of consent to access SRH services. The lack of access of comprehensive SRH services has contributed to many challenges: teenage and unplanned pregnancies, unsafe abortions, and all that contributes to high mortality, high HIV and STIs incidence among young people, and adolescents mortality. And then from the progress report on the 1990 global fast track targets on HIV, 48% of young people in Zimbabwe do not know their HIV status. And it's because they need parental consent before they can access that service. And then according to UNAIDS 2020, in sub-Saharan Africa, 5 in 6 new HIV infections are among adolescents aged 15 to 19 years. And then the current pandemic, COVID-19, has also brought lots of challenges in terms of access, availability, and affordability of HIV and SRH services for many people in Zimbabwe, and the young people are most affected. And then unpacking social accountability monitoring. Social accountability monitoring for adolescents and young people, fostering engagement between young people and sexual and reproductive service providers and the policymakers. And the policymakers, I'm sure, are listening as we speak, to strengthen the quality and responsiveness of service delivery. This will ultimately lead to realization of SRHR amongst adolescents and young people, the SDG 3 and 5, which I already alluded to. What are some of the gaps and challenges? I did not separate between gaps and challenges, but I want people to appreciate the challenges which the young people in Binga, in Zimbabwe as a nation, are facing, so that they will understand where we are coming from in terms of trying to garner the support of the policymakers on how we can really improve the service provision. There are no young people who are service providers at the facilities. And as a result, we find that the young people want to access services at times because the people are older than them. They may not feel comfortable to visit the sites. Service providers are also not trained in youth-friendly services. So apart from them being older than them, also they are not trained in youth-friendly services. Again, this may shun young people from obtaining services from these health facilities. There are no youth-friendly corners in the district, so the young people are mixed with the older people when they're getting these services. Again, this may shun them from accessing services from the health facilities. They walk long distances. According to the National Health Strategy, a health facility is supposed to be at a diameter of 5 to 10 kilometers from every household. But in Mbinga, they even walk as far as 30 kilometers, even though I've been modest and put 25 kilometers, but they can even walk something longer than that. And as we all know, sexual gender-based violence is very prevalent. So as you walk across thickets of 30 kilometers, they are also exposed to other dangers of sexual gender-based violence. There's lack of adequate information among people on SRH information and services, inadequate family planning commodities. At times, you may get a commodity, for example, the implants, but you may find that the service providers are not trained to actually insert the implant. And therefore, it also limits the choices of the young people on the method which they require. Adolescents are not involved in budgeting processes, consultations, and planning. I think the 5 processes with which Warren spoke to, the adolescents need to be also involved so that their priorities can be heard. And then policy illiteracy, young people are unaware of existing policies relating to SRHR. I think the policy should be in simple language which they can understand and also interrogate if maybe it's not friendly to them. Social, cultural, and political barriers hinder effective social accountability monitoring. There's limited knowledge and access to same structures. Young people do not know who to approach for advocacy purposes. For example, if they've got an issue, they don't know who they can take that issue up with. Ineffective utilization of channels to report poor service delivery, because we know that poor service delivery may actually prevent young people from visiting the facilities, but there are no means of actually reporting so that they could be improving on that. And COVID-19, like I've already alluded to, it has brought a lot of challenges in terms of access to SRH services. What are some of the recommendations which the Mbinga community have brought? All this information which I am talking about, it came about after we did a scorecard mapping, and it was actually coming from the young people as well as the district stakeholders within Mbinga. So one of the recommendations, meaningful participation of adolescents and young people in public resource management processes, including attending the ward level meetings where the planning begins, as well as the village meetings also, as well as council meetings. Support in establishment of youth-friendly centers from government stakeholders, especially Ministry of Health, as an NFEC, but this can only be available if the budget, the national health budget, already is apportioned something for SRH services. There's also unavailability of adequate SRH material, and more so in appropriate languages. A lot of material is there in English, but in Mbinga, we speak Tonga, and therefore we will better understand whatever is written down if it's written in Mbinga, in Tonga, sorry. Representation of SRH issues at national level by members of parliament, playing their legislative, their oversight, and their budgetary role, so that of the 15% budget, if we meet the Abuja Declaration, if 3% could be allocated for SRH services. And support young people as they advocate for their SRH rights in Mbinga, supporting, for example, with resources so that they can also be able to meet and discuss some of these issues which actually hinder them from receiving SRH services, and then ending up with unwanted abortions, as well as unplanned pregnancy and so forth, leading to high mortality for the country. government and stakeholders and citizenry to shun prejudices, negative cultural practices, and any forms of discrimination against young people. And then also we recommend that the health center committees, which were spoken about even during AAZ briefing, to be revitalized, because within the health facilities where the young people access SRH services, the health center committees are going to be the conduit between the service providers and the young people, so that any issues coming from the young people can be channeled appropriately to the service providers through this health center committee when they have been vitalized and they are active. What are some of the questions which I may want to pose to all of us? What can we as civil society, the parliamentarians, and SADCPF do to address social accountability in the implementation of SRHR regional commitments in Zimbabwe, or specifically in Binga, as I'm saying? And what can be done differently in the current COVID-19 environment to ensure access to SRH services by adolescent and young people, so that we avoid those complications which I said result in the inadequate provision of these services? And then this next slide is just showing where most of the information which I was presenting on special notices came from. Otherwise, I think my presentation ends here. Twalumba, Tawoka, Tatenda, Siawonga. Thank you. Back to you, Madam Chair.
Thank you very much, Madam Makumbe, for a beautiful presentation. Without taking much of time, I'm sure honorable members would like to ask questions arising from all the presentations that have been made so far. At this moment, I would like to call upon my colleague, Mr. Shunene Kurasha, to take up the question and discussion session. Mr. Kurasha, are you ready?
I'm ready, Sharon. Thank you very much. Honorable members, once more, good afternoon. We wish to open for comments and questions, and our presenters, our resource persons, will be on standby to respond to the questions. When you pose the questions, kindly indicate who you are posing the question to, so that we are more focused in the question and answer session. I see Honorable Sansol, and I also see Honorable Mpariwa. I give you the floor in that order.
Thank you. I want to direct my question to Mr. Chiwore. The Budget, Finance and Economic Development Committee is the lead committee, in my opinion, charged with the responsibility of ensuring that the allocation of resources meets the regional thresholds that have been referred to in the various presentations. Now, this morning, in your opinion, does the present structure of and the format of the budget consultative meetings that we do as Budget, Finance and Economic Development ensure that smallholder farmers are adequately consulted in the budget formulation process, considering that the committee does consult associations in addition to the public meetings, associations such as the Bankers Association, ZNCC, National Chamber of Commerce, Chamber of Mines, and so forth. Do you think that we, as a committee, adequate consultation is done with the small?
Thank you very much, Honorable. We move to Honorable Mpariwa.
Thank you very much, facilitator. Let me begin by thanking our esteemed facility presenters for very good and informative information and presentations. But perhaps really to find out from the first one is to the Lightmoy from Action Aid, just to find out so that we don't actually get away from the mantra, leaving no one behind. She mentioned on the about the social accountability committees made up of 28 the males and female. I wanted to find out in the committees the composition on how many youths, how many people with disabilities are also part of the accountability committees, so that there is no social exclusion, but there is inclusion in terms of economic inclusion and empowerment. My second point is just brief to Director Chico Chivore. Yes, I couldn't agree with you more, Mr. Chivore, when you mentioned about monitoring in terms of getting to see things done about the social accountability and the monitoring framework. But perhaps really to add on the monitoring, you also need evaluation as a component so that there is impact assessment so as to adjust and make improvements for the future. That ends my comments. Thank you.
Thank you very much, Honorable Mpariwa. Honorable members, are there any further questions?
Yes, you can see my hand.
Honorable Labode, good afternoon.
Afternoon, sir. How are you?
Very well, thanks. You have the floor.
Thank you very much. And thank you. I don't know who PSA is, but I suppose I've been working with them either through Safe-Aid or through Action Aid. I'm not sure. But I was looking at the concept note, and I was a little bit disappointed until Safe-Aid brought to fore or to the political agenda the elephant in the room, which is the legal framework for access to contraceptives or to SRH services. Because I was having a problem last night when I was going through all this. We want to increase domestic funding. Do we think that if Minister Mtuli gives us 20% of the fiscus and we put it in SRH services, we put condoms hanging, and contraceptives hanging everywhere, will the youth we are targeting be able to access when the legal framework says no, or they'll just expire? It's very important. That is the elephant in the room. Yes, we have so many hurdles to that access: poverty, culture, and religion. But let us be realistic. Currently in Zimbabwe, a petition did come to Parliament. It hit the wall. I'm happy to say there's another minister who has decided he's bringing it again in another form, but it is almost the same thing. But the most important thing here is we cannot, as a Zimbabwe, as a country, pretend that we have no problem. Statistics say 1 in 3 girls before the age of 18 are married, as recently shown by this Marange girl who died delivering at 14. She's not a unique case. She's one, but in millions, thousands of girls. We are also told 1 in 5 girls before the age of 18, they are pregnant. And the statistics which ministers have brought to Parliament indicating that for sure that is happening. So if we are serious about meeting our international and our regional goals, as I've heard SADC even has, this is why I asked Mabeneki to say, send me that SADC commitments on SRH, because it's very, very clear. So my cry to, especially to the Secretary General Boema, start now a dashboard of peer reviewing countries within the SADC, which you even take to the AU. We want the dashboard which flashes like a traffic robots. We used to have that for maternal mortality, where when heads of state come, their country, when they say teenage pregnancies, it will flash red, which means mnengos. Then if you're okay, you are yellow. If you're good, you are green. Let's start that, because some heads of states for sure don't know what's happening in their countries because they have bottlenecks here, people who are not telling the truth. That's how I feel. I really feel very strong that we should include, even in your scheme, which was shown by somebody from Action Aid, that dealing with the illegal framework is very important for so many issues. Maternal mortality in Zimbabwe currently is actually coming from teenage pregnancies, is increased by teenage pregnancies and increased by unsafe abortion. So how can we meet our SDG goal? As I'm sitting here, I don't see us actually meeting our SDG goal on reproductive health because we don't have the framework or the strategies to deal with it. Because girls, while you can restrict access to health services, you can't restrict them from sex. Trust me. Then I wanted to say something about agriculture. I'm not an agriculturist, but I'm a small-scale farmer. I strongly feel that Mr. Madzingwa and Mrs. Mpofu, it's about time. I don't know whether this should go to the Ministry of Small or Medium Enterprise or to go to the Ministry of Agriculture. They need to allow you to do study tours to other countries so that you learn, like we had a bumper harvest this year. If you go towards Mtoko, towards Murewa, but tomatoes is almost like maflaus, selling for next to nothing. Those people, I'm sure, are losing because my prices are now, they are just too low. So what I'm saying is, let's learn to add value, to preserve some of these things when they happen. In particular, make reference to tomatoes, bambaira, and bananas in Manicaland. If you go to West Africa, you need to be taken to West Africa. They have what is an industrial, a metal thing that works without electricity. If you have too many tomatoes, you take them there, they are ground for you. When you finish grinding them, you make a tomato paste. Because you have no fridge, you are in the rural areas, you put it in oil, you fry them until that acidity goes. And then you package them like the way we put my bottle of peanut butter. You put them there, either sell them to people who want them. It's called, in Russia, it's called compote, or you actually use it yourself in future. Take bananas. Bananas, when I was in Nigeria at the international airport, I saw them in the duty-free shop as chips, packaged nicely and labeled. Go to Mbambaira, the same I saw. Mbambaira, you boil it, half part boil it, cut it into chips, fry it, let it dry. All you need from these ministries is to expose you to these things, then provide you with the alternative technology, which is just a packaging in the form of in bananas, and that machine, I'm sure it can be found. We can go and find it. The Rayonari market, and the electricity, and it grinds. So I think it's about time you started looking for a way of ensuring that kanamune excessive right now, my banana or my tomatoes are anyway. Sorry, thank you very much.
Thank you very much, Honorable Labode. We'll take one more question and then we allow our resource persons to respond. I see Honorable Doubt Ndweni.
Thank you. It's actually Honorable Molokele using the device for Honorable Ndiwani.
Okay. I recognize you, Honorable. You have the floor.
Yes, the point that I had raised my hand for before I raise it, I just wanted to follow up on Dr. Labode's point at the end. I think we need to accept that our agroeconomics is still based on a colonial concept where we do the basic production and Europe processes. So we need to up our game in terms of making sure that our agriculture is designed in such a way that the end product is not the basic one, but we have to beneficiate our products. We need to bottle them up, we need to can them up, we need to sell them in supermarkets. So there is absolutely no need for the small scale farmer to see their product rot or to sell them at such a cheap giveaway price. Their products should be sold not just in shelves in Harare, but also in Europe and America. So we need to go beyond this economy where we produce for Europe and it's a colonial infrastructure
where Africans were meant to produce the basic products and then Europe beneficiates it. So we need to turn this around. Like she's saying, we need to learn from other Africans and start to beneficiate our products and create value out of them. Let's not just sell them raw. Let's process them. Let's preserve them. Let's create markup on them. That way we reduce the poverty that we have, especially in rural parts of Zimbabwe and Southern Africa. And then my point I directed to staff aid. It's regards to the SRHR. I wanted them to give us an analysis with regards to where we are in the context of the ESA commitment on comprehensive sexuality education, and how does the context of ESA commitment affect their engagement of adolescents, especially adolescent girls in Zimbabwe and indeed in the Southern Africa region. Because we know that access to SRHR services for teenagers, especially adolescent girls, is a big challenge in Zimbabwe and everywhere else. How is SAFE using the ESA commitment on comprehensive sexuality education to try and improve the situation? Because this is a very patriarchal situation where the boy child is benefiting from the current status quo, but the girl child is being disadvantaged, especially when it comes to access to SRHR services, including contraception. Thank you so much.
Thank you, Honorable. I now invite our resource persons to respond to the questions.
Thank you, sir. Maybe let me first respond to Honorable Sansole, who asked about the formal consultations that the Budget Committee undertakes, where he was asking whether it's inclusive of smallholder farmers. The way the consultations for the Budget Committee are structured is that they want to reach all corners of the country and all provinces. And they are structured in such a way that you pick an area that is predominantly a mining community. You also pick an area that is predominantly agriculture, and that's why they are spread across the country. In that way, we try to make sure that you also visit areas where you have small scale farming activities that are ongoing. But however, be that as it may, if you fail to get information or inputs from the smallholder farmers, because what I know is, as the Budget Committee, you don't target them specifically through their associations. It's then the responsibility of the Agriculture Committee to do that and also bring whatever they would have obtained through their own consultations, because they are the ones who deal directly with the associations for small-scale farmers, association for commercial farmers, and associations for farmers who grow certain types of crops or keep certain types of animals. So their own report will also feed into the budget, pre-budget report that goes to the Ministry of Finance. So in a way, I think they are consulted. Then Honorable Mpariwa, it was just a comment on evaluation to ensure the impact, that impact assessments are done. And I appreciate that comment, especially coming from you, an executive member of the African Parliamentarians for Development Evaluation. So I appreciate that. And the evaluation, like you rightfully pointed out, is a very key component in social accountability. After everything is done, you need to look back and evaluate what you have done and see whether you've done it correctly. Where there are gaps, then we go back and we try to rectify. That's the whole.
Thank you, Achwari, for the responses. May I invite SAF aides to take the floor and respond?
Thank you, Mr. Facilitator. I'll come in for surface. Then, if my colleagues have anything to add, that's they can also contribute in. And thank you to Honorable Molokele for that submission and question on any assessment or evaluation of the ESA commitment in terms of how, as a country, Zimbabwe has fared. And this is really an interesting question, an interesting observation, especially given the fact that the establishment of the ESA commitment itself, as it dates back to around 2013, set in place 9 key target areas that were very important and still remain to be very relevant. You recall the ESA commitment was supposed to, and indeed did expire at the end of 2020. But there are now discussions and commitments to look beyond the post-2020 focus with the ESA commitment. And those 9 target areas really spoke about issues that are relevant for adolescents and young people in the SADC region, Zimbabwe included, where one of the indicators was speaking on the need to establish and ensure that a good quality comprehensive sexuality education curriculum framework is in place. And I should make mention of the fact that as a country, Zimbabwe has done well in that regard, with support from non-state actors in making sure that comprehensive sexuality education, though even at regional level, this is something that has been received with reservations, with controversy, because then, given our social underpinnings, the word around sexuality and sexual education in some instances has not been received very, very well. But I should mention that the country, together with other partners, support from UNESCO, support from others like SAFED, has really done well in terms of making sure that this target on ensuring the existence of a comprehensive sexuality education curriculum framework exists in place. Of course, the post-2020 discussion has to ensure that this momentum is sustained and all stakeholders are also brought to the table to kind of build the critical mass to resist, as we have experienced from 2013, was there have been pockets of resistance to the implementation of the comprehensive sexuality education. Then another target of the ESA commitment focused on ensuring pre and in-service training on comprehensive sexuality education and sexual reproductive health training. This is something, again, as a country has been doing well and trying to ensure that it is done, especially on in-service training. Those who are privy to what has been happening to schools, and members of parliament here represented can also confirm this. There's been some kind of revolution to our curriculum, the education curriculum, where the educators and the school children, there's really been some training, in-service training, to make sure that teachers are equipped in that direction. Perhaps what still needs to be done more is the focus on pre-service training for educators, so that when they come into the school system, they are already ready to deliver on comprehensive sexuality education and sexual reproductive health rights. Then there was another target which was speaking to the need to reduce by 50% the number of adolescents and young people who do not have access to youth-friendly sexual reproductive health services. This is something that, because perhaps of the macroeconomic environment and other circumstances from without, the country has been trying to make measures in that regard. But if you note, there have been some areas where we still need to do more. My colleague Sazi made a presentation of the situation in Binga, where, and this is common not only in Binga and in some areas across the country, where access to youth-friendly, as in being youth-friendly services, remains to be a challenge. Some issues with funding, issues with the infrastructure, where issues of confidentiality and privacy remains to be compromised because of the nature of the physical environment, and at times it's as a result of the lack of properly trained staff who are supposed to be manning and giving support to those structures and services. Then we also have the elimination of and we have done well generally in this regard, but recent studies, especially from still confirm that the country still need to do a lot post 2020 to eliminate new HIV infections. Because understandably, some studies have indicated where is a surge in new infections among especially the adolescents and young people. This is the 10 to 24 or 15 to 24 age category. Then there was also a target on the ESA commitment which looked at to increase the number of adolescents and young people who demonstrate comprehensive.
It looks like we have lost Adolf. At that note, do we have anybody else from SAFAIDS who may wish to take over from where Adolf left, or someone from Action Aid?
So my network, let me just finish what I was speaking about. Sorry, my network dropped me off.
You're still breaking.
The other target spoke about.
You're still breaking.
Hello, can you hear me?
I can hear you now.
Oh, so you can hear me now?
Yeah. Yes, proceed, Adolf.
So I was saying the other, yes, so the other to the ESA commitment focused on the need to increase, at least by 95%, the number of adolescents and young people who demonstrate comprehensive knowledge on HIV prevention and knowledge levels. And again, a lot has been done at national level, but we still need to sustain the momentum. Because studies, recent studies, and in our engagement with communities, there are still some significant pockets where some young people still lack comprehensive knowledge on HIV prevention and knowledge levels. Then something which was also interesting from the ESA commitment as part of the targets, there was a focus to decrease by 75% early and unintended pregnancies. This is something that countries, including Zimbabwe, has been battling with. Evidence from where we are working, evidence through the media and other sources are also pointing to the fact that in as much as a lot has been done, but the challenges around this area remain daunting, and quite a lot needs to be done with the support from all stakeholders. So the long and short, Honorable Molokele, from your submission, yes, there has been an evaluation and understanding to look at how the ESA commitment was such a commitment, because it has clear targets that looked at elimination of gender-based violence, elimination of child marriages, introducing comprehensive sexuality education in the school curricula, and all that tried to mobilize member states, Zimbabwe included, in terms of how that can be addressed. But a lot has been done, but still the momentum needs to be sustained, especially in the post-2020 discussion around the ESA commitment, because it was timed between, it was supposed to last up until the end of 2020, but discussion, because of the gaps that still exist and the gains that were made that needs to be sustained, the discussion has now gone beyond 2020, just to sustain the gains and make sure that we plug on those daunting challenges that still confront the discussion around the realization of the ESA commitment. I submit, Chair.
Thank you very much, Adolf. Any further comments from Action Aid or someone else from SAFAIDS?
Thank you, Honorable. Thank you very much, Adolf. I think Adolf has actually spoken about all, but I just wanted to emphasize on the issue of youth-friendly corners. For example, in Binga, I think we mentioned that the health facilities which we are working with, it identified some rooms where we could convert and make them youth-friendly corners, which would furnish with the materials, like IEC materials written in Tonga and so forth. But unfortunately, due to funding constraints, those youth-friendly corners are still empty. And this is why we're saying that maybe we need a lot of support from the powers be on how we could go ahead to furnish them with the necessary equipment, which will attract the young people to come and utilize them. And this doesn't only happen for Binga, I think it happens across Zimbabwe. Thank you.
Thank you very much, Action Aid. We go into a second round of questions. We will have the opportunity to also take questions from the chat box. At this juncture, I invite Honorable Kashiri to take the floor.
Thank you very much.
Honorable Kashiri, are you there? Looks like we have lost him.
Apologies, Chair.
Mm-hmm.
Oh, this is Delight from Action Aid. We had a question from Honorable Mpariwa on the social accountability committees, which we did not answer.
Hello?
Hold on, Action Aid. Yes, Honorable Kashiri.
Can you hear me now?
Yes, I can hear you. Please proceed, Honorable Kashiri.
Kashiri, permission granted, you can speak.
Looks like he's breaking. Parliament of Zimbabwe ICT, are you able to assist Honorable Kashiri?
He's not in.
Okay. While we are waiting for Honorable Kashiri to come back on the platform, I wish to invite Action Aid to respond to the question by Honorable Mpariwa.
Thank you very much, Chair, for the flow. So thank you, Honorable Mpariwa, for the question on the social accountability members that we are working with. So the 28 we had alluded to earlier on in the presentation, those working in the Mutoko district. But in each district in Binga and Mutoko, we do have the social accountability members. In Mutoko, we have 28. And in this 28, we have 9 young people, 5 of which are female and 4 males. Then we have 10 females and 9 males. And this includes the councillor, headman, the agri-tax officer, as well as someone from the Ministry of Health. And in Binga, we have 10 young people who, and in Binga, they are all young people, 6 of which are young women and 4 are young men. And these young women have gone on to at ward level to have groups of 25 people each, with 15 young women, 10 young boys being part of their social accountability groups. Maybe as shared, as asked whether we have any persons with disabilities on the committees. At the moment, we don't, but the way the committees work is they work in a snowballing manner where they share the information that they're getting through the ward level and village level meetings. And from there, we will, it is our hope that they do meet the various groups and do work and share information with them as per the social accountability ecosystem. Thank you, and over to you, Chair.
Thank you very much for that response, Action 8. We appreciate. Honorable members, may I request, Sharon, are you able to take the questions that to read out the questions that are in the chat box?
Thank you. Let me start with one from Banana Hatata. This is from a journalist from Lesotho, Outmate Radio. The question is the problem of land ownership and other challenges like proper access to finance specific to married women or to all women?
Let's proceed to the next question.
Then the other question says, how best can we help adolescents to have access to SHR services, because most young girls lose their lives trying to terminate pregnancy, which come accidentally because they are not allowed to access HRS services. And then the other one is just a comment from Edmond Mukaratika. Is ending HIV/AIDS premised on any scientific discovery or breakthrough? It's imperative to be clear so that we do not give false hope and promote promiscuous behavior in anticipation of impending end to the
Thank you, Sharon. So we have those 3 questions from the chat box. Our resource persons, please take note. And I wish to give Honorable Kwaramba the floor before we hand over to our resource persons. You have the floor, Honorable Kwaramba.
Yes, thank you very much. I have noticed that whenever we move around during budget time, where we ask the people to make their input into the budget, we have discovered that adolescents do not attend these meetings. Yet we are saying adolescents need to be involved in the budget process. Now, how do we encourage them to attend these meetings so that they also have their input? Thank you.
Thank you very much, Honorable Kwaramba. We have the questions. Yes, there is a request for a supplementary. Please proceed, Honorable Labode.
Yeah, thank you very much. I just wanted to now encourage civil society organizations, especially Safe Aid, since you are in Binga. The public hearings will be taking place second week in October, all things being fair. And one of to collect input into the 2022 budget. So I'm urging you as an organization to ensure that all the youth you work with, they galvanize other youth in Binga and attend, because Binga is one of the areas we are going to be. And this applies to every other district where you work. Thank you.
Thank you very much, Honorable Labode. Honorable Mkaratiwa, is that an indication that you want to restate your question? Honorable Mkaratiwa, I see from the chat box, I want to understand if you are seeking to restate your question. You are muted. Okay, there's an indication that the question by Honorable Mkaratiwa was not read properly. Let me retake the question. Is ending HIV/AIDS premised on any scientific discovery or breakthrough? It's imperative to be clear so that we do not give false hope and promote promiscuous behavior in anticipation of impending end to the pandemic. And he's saying it's a question, so that needs to be responded to. I now hand over to our resource persons to respond to the questions by the honorable members, as well
can I
as
just
the...
add something to Mkarachiro's question? To put
Yes,
it in I want to put it in his perspective. I'm assuming he's asking in relation to the SDG goal 3 for 2030, the 95, 95, 95. He's saying, is it premised on science? Personally, I know it is, but I'll not answer.
Yes, after the response from the resource persons, if you feel you want to make an addition, please feel free to do so. The chair will recognize you, Honorable Labod. Thanks for that clarification. Resource persons, can we respond to the questions? Safi aids?
Thank you, Chair. I will respond on is it Honorable Kwaramba, who asked about the absence of young people on the consultative processes on the budgets.
Yes, please.
Yes, where her concern is in a majority of times, young people are not present, which is worrisome. Yes, that's an acknowledged concern that generally young people come in very few numbers at those consultative processes. And for the few that do attend those consultative processes, very few again do share their concerns at that platform. This is something that we have also experienced and witnessed in our engagement with young people. But the submission is there are a lot of reasons that needs to be done or to be understood with the engagement with young people to try to understand why young people are failing to participate in those very important national level processes. One of which, as my colleague Sazi mentioned earlier on, we've got cases in areas like Binga, where one of the reasons could simply be issues around access, where some of the consultations might be placed in places where not the majority of young people may be able to access. So there's physical accessibility of some of the places where the consultations will be happening. Then in what we have also captured around similar interventions around the PSA Alliance project through our community scorecard process and the district scorecard processes is we do have the lack of participation, because there's also a gendered perspective to the participation of young people. In some cases, we only have young people as males who are participating, but females are very noticeable for their absence. So there's a gendered perspective where adolescents, young people, and young people in general, if they are females, they are usually do have their time spent doing household chores. Therefore, to think and imagining getting to a public place and give their views on a national budget consultation, because of their prior engagements on household chores and other non-paid care work that they do at homes, they therefore naturally are not found in such places where their views need to be shared. Then there are also cases where young people may fail to participate in national budget process simply due to the absence of knowledge when such processes are happening. it's good that Honorable Labode, you've mentioned that there is a process which is for coming in being on the first week of October. But we've had experiences in the past that when young people at local level may miss on the dates, and therefore their views get missed in the process. Then there are issues around lack of knowledge. People do turn up, young people do turn up, but they fail to contribute and contribute meaningfully because they have not been properly engaged. They have never been properly prepared to speak on those spaces. So at the end of the day, they are there physically, but they may not contribute meaningfully. So what I'm saying at the end of the day is there is need for us to together as a civil society, together with parliamentarians, to properly and meaningfully engage our young people well before the national budget consultation, just as a part and parcel of pre-positioning them, preparing them that we've got such processes. You deserve to be in those platforms. You deserve to be speaking on issues that affect you as a young person. Then in that case, you will have young people or groups of young people who are ready to take on the processes, who are ready to make sure that their decisions are taken care of. And that can be well done if we strengthen our collaboration between parliamentarians and non-state actors, and especially with civil society organizations. But there are quite a lot of reasons that needs to be understood why young people participate in very few numbers. Some of them are cultural, some of them are just context specific, but I think all that can be broken down if we strengthen the collaboration and kind of working hand in glove as partners to make sure that we strengthen the voice and we strengthen the representation and the agency from young people. I'll have to end here. Honorable Chair, I submit.
Thank you very much, Adolf, for that comprehensive response. There's still some questions that are unanswered, and I would still want to call on our resource persons to respond to those questions. Action 8. Mr. Chiwore, do you have any of the questions that you may wish to attempt, including the issue of access to consultations for young people? If you want to give a response or any of the other questions.
Sorry.
Oh, thank you. Perhaps I can respond on access to consultations by young people. What we do at Parliament of Zimbabwe is we advertise the consultations on radio stations, in the newspapers, and on we also use posters and the community WhatsApp groups through the district administrator's office. So you may then get an invitation to come to a consultation, but we admit that we cannot cover every corner of the country because we can only do as much as the resources permit. But we have other platforms where young people can also contribute. These include the local radio stations where you have your members of parliament that go on radio. We are trying to use all the major radio stations who will be sort of small casting on their sister radio stations. It will be a phone-in program where young people can air their views. We also have social media platforms. We have WhatsApp, we have Twitter, we have Facebook, where young people can also air their views. And one interesting thing this year is we have created a platform where we are inviting the junior parliament to our budget pre-budget seminar, where members of parliament interface with the Minister of Finance in trying to then air the views of the public to the Minister of Finance for incorporation into the 2022 budget. So we have invited the junior parliament to also come and represent the youth in as far as their issues are concerned. So we expect young people of Zimbabwe to empower their junior parliament, maybe through the child president, the one who was there 2020, because I understand 2021 they hold any elections. They empower that young man or young woman to come before parliamentarians, before the Minister of Finance, before the Speaker of Parliament, they air their views. Then we'll assist them in tracking their recommendations, implementation of their recommendations. So those are some of the platforms that are open for young people to also make a contribution to the budget. But it's not only the budget. We have other public consultations on various other issues, including bills that will be before Parliament, which are widely advertised, and we expect young people to also come and make their contributions. If they can't make it physically, there is an email that is always available 24/7, clerk@parosm.gov.zw, and you can send in your views, and we assure you that that email is opened and your views are taken seriously. Thank you very much.
Thank you very much, Mr. Chwore. There is also a question on the issue of access to HR, then the 90-90-90 strategy question, and then the last one related to access to land. Is it confined only to married women? Those three questions are not yet fully answered. I would want to invite our resource persons to quickly respond to those so that we move to the next set of questions. Action 8, anyone in the house?
Sorry, Chair.
Yes, Adolf.
Yes, thank you very much. Let me try to come in on the one I think asked by Honorable Mokarati Gwa on whether the narrative around ending HIV and AIDS by 2030 is based on any scientific knowledge or scientific discovery. Because according to the esteemed Honorable is we need to run away from spreading false hope. That's according to the Honorable, and therefore it may have unintended consequences. I'm not speaking as a scientific guru, but just to acknowledge the fact that the narrative around ending HIV by 2030, it is a narrative that has been agreed on and upon by various stakeholders in the HIV response globally. And it is a narrative or statement which is based on acknowledging all our efforts from national level to global level, all our efforts since the inception of HIV. You remember at the inception of HIV, it was taking us in huge numbers. At the inception of HIV, there was no medication, but thanks to research, thanks to medical studies, the advent of antiretroviral therapy, for example, revolutionized the HIV response globally. And because of such interventions from a medical perspective, it has really motivated stakeholders, including member states, in the global HIV response to say it is a possibility. We can motivate ourselves to bring HIV to an end. Because look what, for example, the art therapy has done. It has revolutionized, it has saved lives, it has also made sure that economies remain working. Then if you understand that the response to HIV is structured from different angles. One is the biomedical approach, which focuses on the administration and research into art, for example. You also have other approaches like the behavioral approach, which looks at how we can mobilize our communities, national governments, locally, regionally, and internationally to respond to HIV from a behavioral perspective. This is why from the early 90s up until now, there was so much good work which was done by prevention awareness campaigns, the prevention revolution. And that was also again acknowledged, and stakeholders agreed and say, it is a possibility that if we are going to sustain the current interventions, we can do better. And ending HIV, therefore, it is a possibility. But what I want to caution, therefore, is that narrative and statement should not bring false hope. But what it should do is to make sure that we sustain the hope, we sustain the current efforts, we sustain and safeguard the gains that we have made since the inception of HIV, to make sure that as we go by 2030 and going into 2063, which is the Agenda 2063 for Africa, we ensure that we have protected the gains, they are safeguarded, we ensure that we nip new infections in the bud. It's not going to be an easy journey, but at least that narrative which says, let's end HIV by 2030, it is both inspirational, it both brings in the kind of advocates that we need to put on the table as stakeholders, and it motivates stakeholders, individuals, states, individuals, multilateral partners to work together, to collaborate together, and ensure that especially we sustain the gain, especially we keep new infections at bay, and especially we maintain the investment on medical research. We maintain the investment in making sure that the response in terms of messaging, the response in terms of communication remains sustained at the end of the day. But I don't want to get into that pitfall where I would sound scientific, so to speak, and say this is based on any scientific discovery, but it is a motivational, it is a promissory statement, and it is meant to sustain all our efforts and make sure that we safeguard the gains. Thank you, Chair. I submit.
Thank you very much, Adolf.
Supplementary?
Yes, Honorable Laborde.
Thank you very much. Honorable Mkaratirwa, Zimbabwe is a very good example. The premise of the global goal for 2030 is made with a lot of research at international level. Even at local level, I'm not going to go at international level because there are a lot of money, over 2 billion goes annually towards the research of how do we eliminate HIV? How do we end it? In Zimbabwe, I'll tell you something. Because we have reached 90% of the people who are supposed to be on art, we have actually drastically reduced the transmission from somebody an HIV to somebody SINA. There was a time when the incidence was very high, but now among the adults, we don't seem to be actually getting new cases as much, because those who were infected, when we captured them, we put them on treatment, and once you're on treatment, you were less likely to transmit. So the argument is, if by 2030 we arrive with 95, we can actually end HIV. And the good example, our challenge in Zimbabwe currently is the adolescents. That's where you see the new cases, because they are spreading among themselves. They can't access condoms. But in the adult groups, because of condoms, because of art, we are actually going to achieve that goal. Currently we have Botswana. Botswana Global has been said by the Global Fund that they have achieved their 95. In Botswana, they've actually achieved it now, which is a goal for 2030. And their results show that they have even reduced the domestic funding towards HIV, because they believe they've gotten to a level where all those who are positive, at least 95%, are getting their treatment. And the viral load in the community, even in Zimbabwe, is very, very low, because we are on treatment. So because we are on treatment on art, our viral load is low. You cannot transmit the virus. That's what I wanted to say. Science, bruh.
Thank you very much, Honorable Laborde. Indeed, 95 strategy. The question on access to land and microfinance by women, whether it's confined to married women. Action 8, do you want to respond on that?
I'm Chengeto Mzira, a young farmer from Togo.
The issue of access to land is not only a challenge to married women only, but it is also a challenge to us as young female farmers. If I may say, for example, I cannot access land in my communal area because they will argue that I will get married and then I will leave the land. And when I get married, land ownership, like the husband is the one who owns the land. Everything is registered in the name of my husband. And at the end of the day, when he dies, it is changed and ownership is given to the first son. Though there has been changes in the inheritance laws or act that says that when the husband dies, the woman is the one who inherits. But practically on the ground, that is not what's happening. And then on the issue to financial resources, there is need for collateral. But in as long as I don't have anything in my name, I cannot access the financial resources because I don't have collateral. Thank you.
Thank you very much, Madam Young Farmer, for that articulate voice. At this juncture, I want to open for probably the last round of questions. Honorable members, I recognize Honorable Masia. Honorable Kwaramba, is that an old or new hand?
Thank you. Good afternoon.
Good afternoon. Please proceed.
I just want to make a follow-up on the nations may be failing to make youth join or participate in the nation building. It is quite an interesting case. It is all over, especially in the bordering areas. I happen to be coming from Uchireti. It's an outside district and an outside constituency. It is a thorny issue that as a nation we are failing to catch the youth. True, I want to think that we lack correct researchers to find some way to catch the youth. You will see that even political parties, which need out of a ward 40 to come up with a structure for youth, you can hardly get a full structure of 40. Besides that, the youth are the majority in any ward, but you can't get 40 to fill up your structure. The point is probably that we use the adults to catch the youth. I think that's where we are probably failing. I think even the parliament youth, it so happens that when they are invited, they are addressed by 50 adults and maybe 2 or 3 youth, which to them is not good. I find that out there, where they mobilize themselves through football fields like these outdoor games, you find them, there are many those people. They are able to mobilize themselves than maybe the adults mobilizing the youth. It is true that in as much as we are concerned, like Dr. Laborde said, we are very concerned that at the end of their own games and that not at night, these youth engage in sexual activities, thereby spreading HIV and that not. Catching them to understand AIDS, the word coming from the adults, becomes another question. Are we able to put them together and then tell them the correct thing? We don't seem to be okay. They don't like us. They want to be independent, do the wrong thing or do the right thing. I don't know if we really have correct, I want to ask our researcher if we have a proper team or body to research on the youth, because we are failing them. I think we are failing them. That's my contribution. Thank you.
Thank you very much, Honorable Masia, for that question, comment, very subtle observation on the question of opening space for young people to participate in the public policy making process. Any further questions, honorable members? It does not look like we have any further questions. I wish to give our resource persons the opportunity to respond. If there are any young people in the meeting who may wish to also take a bite on the question of youth participation, you are free to do so. Indicate and I'll be able to give you the opportunity to make your submission. Resource persons?
Honorable Chairman.
Yes, ma'am. Yes, sir.
Okay. I'm not a young person. I'm an elderly woman. I just want to echo to the issues of youth participation in all our work, especially in the agricultural sector.
Sure.
It's a big challenge, and I think what is lacking is the motivation aspect. Because for us, we know we are committed, we dedicate ourselves because we know very well this is where we sustain our lives. But with the young people, they want something which is really profitable all of a sudden. So in the agricultural sector, if we can try to strategize and develop some motivation aspects that they can also be interested in these processes. And when we invite them to participate, we should give them the role, the tasks. They should also take the lead in bringing up their issues, not just to follow and say, okay, just because Gogompo has said this, then I'm also there to go forth with what she had decided. They should be given their space and they should be supported in whatever they really need so that they know exactly the benefits of these agricultural processes whatsoever we are talking about. Thank you. I just wanted to add on to that. Thank you.
Thank you very much, Ma'am, for that a profound observation. Any further responses from our resource persons? Could it be that our resource persons are also not as youthful and are feeling guilt? Action 8.
Person is coming to talk. Yes.
Okay.
Hello.
Yes, you have the floor.
I'm Takuzwa Shoko. I'm representing SAF-AIDS. I'm representing the young people, basically.
Yeah.
So I think what we would like is to use people that are in representative spaces, such as young parliamentarians. So you need to equip them with skills to engage with youth in disadvantaged areas, so that they can access and get information on what is needed from the ground. Because basically, as mentioned earlier by Honorable Kwaramba, it is difficult for somebody that is for an adult to come and engage with youth. So it would be easier for youth to relate, much more easier, and also to get, say, involve other youth that are based on the ground, to be, so that you can equip them to be people in in important positions so that they can take responsibility for other groups as well. So that way, there needs to be training happening. You need to engage other youth so that they can, so that they are well equipped to represent, to speak on such stages, and so that they know also the structures of accountability. So what structural accountabilities are needed for us to engage with parliamentarians, for us to engage with the government as well. So that it's not something that is just out to the open. Yeah, we also need to create resource youth networks so that they don't just go in blindly. They are well equipped with what is needed in the societies. What do the policies say? What does the budget entail? So yeah, that's my contribution for young people.
Thank you very much, Mr. Shoko. Very critical points you raised there. The issue of creating champions from among young parliamentarians. It's a challenge that goes to the parliament. And then the issue of building the capacity of young people to be able to engage in policy processes, and the issue of resources. Are there any further comments, questions?
A young person from Binga.
Hello, Action Aid.
Hello, there's a young person from Binga who wants to add to what Takuja has just said.
Please proceed.
My presentation is about what a gender responsive service looks like for adolescent girls and young women.
Yes, please proceed.
A gender responsive service looks like a service which must or is delivered to us young women and adolescent girls without discrimination. Sexual reproductive health and rights services must be equally offered to adolescent girls and boys, regardless of their gender. Normally, the participation of young people, especially adolescent girls, in the budget process.
Honorable Ndebele, there's someone on the floor. I will recognize you as soon as they're done.
Could I just quickly check if that is a woman speaking? Just so that we're in the know.
Sorry. Sorry, Honorable Ndebele.
I just wanted to verify if that is a woman on the floor.
No, they said they're a young person from Binga. They are on the camera now. It is a young man. It's a he for she campaign, Honorable
young women.
All right.
I get it. Understand, absolutely.
Sure.
What we want you to help us, especially in Binga, we have got the problem of contraceptive in health centers. And we have also problem of medical facilities. So may you kindly assist us. And we have got the problem of clinics, whereby from our local place to the local clinics, it's 25 Ks. So it's a challenge which you are facing. And we have also the problem of shortage of water at our rural health center. And we have got the problem of infrastructure development, especially the roads. We don't have the roads. Our roads have got the potholes, and the other vehicles, they are dead because of those potholes. They are damaging other people's things. So that's the challenge which you are facing there at Binga. Thank you very much.
Mkwenyana,
thank you.
tell what
Thank you very much.
can you tell that young man to attend to input what he has said at a budget meeting? Very important.
Thank you very much, Honorable Abode, and thank you for the submission. The Honorable Member is reminding that there's going to be a consultation on the budget by the Budget Committee coming soon, and it will be in Binga. Please take advantage of that opportunity to make submissions to the Committee of Parliament. Are there any immediate responses to the submissions? We need to move towards closure so that we go for lunch.
Kurasha, I think on the language, when the visits by Parliament are in session, let those young people, women, people with disabilities participate and speak in their language and express what they want to put across. Thank you.
Sure, thank you very much, Honorable Mpariwa. And I take your intervention to also mean that Parliament is able to allow the participants to make their submissions in the language of choice, language of preference, so that there is facilitation of engagement.
Yeah, yes, Honorable Ndebele. May I also encourage the girl child to come out and speak for herself, particularly when it comes to certain unique conditions that we may not necessarily experience as men, such as menstruation. It makes a lot of impact if the girl child gets up and speaks to those issues on her own. And I think, like the other honorable member has observed, allowing them to use the vernacular will also be helpful. Parliament recognizes all 16 and now 17 official languages in our country, but it has more impact. It really hits everyone in the face if matters of menstruation and menstrual health are delivered by the girl child. I would like to see more women speak to that issue boldly and convincingly. The Chinese sometimes say, in order to understand a man, you must walk a mile in their boots. In as much as we may want to stand up for our women, but we are excluded from certain lived experiences. So I would like to see more and more girls speak to that before the parliamentary committees. I bet it will have a lot more impact. Thank you.
Thank you very much for that comment, Honorable Ndebele. The invitation for amplification of women's voices by women in order to influence policy and representation. At this juncture, I wish to propose that we take a break for lunch, and I stand guided. Sharon, what time do we reconvene?
Thank you. I think maybe we can come back at 14:30, if that is okay with everyone.
Honorable members, there is a proposal to reconvene, to break for lunch and reconvene at 2:30. Is that okay? Do I have the concurrence of the House?
I think that's okay.
Agreed to. We shall now take a break and reconvene at 2:30. Thank you very much and enjoy your lunch.
We're signing out.
You have an option of signing out, or remain logged in. You can use the same link that you used to join the meeting. Should you choose to exit.
Okay. Thank you.
Good afternoon, honorable members and participants. With your permission, maybe we can give 5 minutes for other members to log back.
Badapinda sha diesel. Diesel chama? Badapinda diesel. Apinda, pare apinda. Said wakapinda.
Good afternoon, honorable members and distinguished participants. Welcome back to the afternoon session. I hope you all had a wonderful lunch. We will straight away go into the first activity this afternoon, which is some videos will be shown where young people from Binga would show some testimonies on their experiences. This also goes for the women smallholder farmers from Mutoko. Ms. Moyo, can we have the 2 videos now, or can we start with the one from Binga? Apologies, honorable members. We're just waiting for Action Aid to get ready to give us the videos.
Hi, Honorable. Ansikubona chini.
Avasati vatanga, honorable.
Johnson, bag. Chata rescue manje kamgaga. Madeza utanga kanone.
Hello, hello. Hello? Hello?
Good afternoon, Honorable Mohadi.
Yes, I can hardly hear what is taking place.
Sincere apologies, Honorable. We are just, bear with us. We are just preparing the videos that are supposed to be shown this afternoon. That is the first activity. So once Action Aid is ready, we'll be able to show the videos.
Okay.
Thank you.
Okay, thank you. We will wait.
Good afternoon, honorable members. We sincerely apologize. I think Action Aid is now ready. Ms. Moyo, are you ready to show honorable members and participants the videos?
Afternoon, Madam Moderator. Yes, we are ready. And we've just gone according to the program with the testimonies. So we have
Please
a young.
Please go ahead.
My name is Mama Ninosimozio from Binga District and our series. My presentation is about what a gender responsive service looks like for adolescent girls and young women. A gender responsive service must be a service which must or is delivered to us young women or adolescent girls without discrimination. Sexual reproductive health and rights services must be equally offered to us adolescent girls and boys too, regardless of our gender. Normally, the participation of young people, especially adolescent girls, in the budget process is very low. So we must attend so that we raise our issues, especially the issue of youth-friendly corners in our clinics for information sharing. This information sharing must be done in a gender-responsive manner without discriminating. Adolescent girls and young women, we must also participate in monitoring and the oversight to ensure there is accountability and transparency with the resources allocated and utilized in the budget process. This is how gender responsibility can be fulfilled with the service delivery to us, adolescent girls and young women. Finally, a gender responsive service must allow young girls and boys to access their sexual reproductive health services as much as they need. For example, girls may have more services needed compared to boys. So the gender responsive services must offer services to meet all the needs of each gender without comparing. Thank you.
Thank you very much for that wonderful testimony. I think we can have another testimony.
Good afternoon, everyone. I'm Chingeto Mzira from Mutoko. I'm a young farmer. My presentation is on how a gender responsive service looks like in agriculture. So just for a brief background, I'll start with the current situation that is in our community at the moment. So as young farmers, we don't have access to loans due to collateral needs that are needed when accessing loans. And also in our communities, there is no reflection on gender roles because the term gender, it's like it's being thrown around. The community doesn't have a deeper understanding on what gender really means. You find out that in our communities, people really think that gender is all about women, but in actual sense, it's not it. So there is a need for the communities to have a deeper understanding on what gender really means. And also in our community, we have seen that most influential positions in terms of agriculture are occupied by men. There are no women in most influential positions in agriculture. And Also, there is no recognition of women in terms of property ownership. Like I had alluded earlier that land, if I'm married, land is owned, is registered or owned by the males. If we look at the stock cards in the communities, they are all registered in the husband's names, as well as let's take for example the issues of input schemes. They would rather write the name of a deceased. If my husband is deceased, they'll write the name instead of writing me as a woman who's staying at the home. And we also have a problem also in issues to do with marketing, as well as access to the markets, due to poor road infrastructures, as well as lack of transportation of our products. Because in Mutoko, we are we produce horticultural products. So we also have issues in terms of transporting our products to the market because the roads are not good. And then we have also noted that there is limited attention to the neglected groups. Like we were saying that women are still marginalized in our areas. So still there is no attention that is being done into making the women to be more recognized. And also there is limited monitoring and coordination in gender responsiveness within budgets. For example, we see that as young farmers, we hear that there are youth empowerment banks, we hear that there are women empowerment banks, but it doesn't reach, the programs don't reach the grassroots. And thus we don't benefit anything from those programs. So there is need for close monitoring and coordination so that all those programs, they reach grassroots. And also as a challenge, we have cultural and religion challenges that in a way suppress women. Because in our community, we can see that a lot of girls are being married at an early age, and it's because of religion and cultural norms. And also that maybe women don't have to speak, let's say in a meeting, whether we are planning something that is agricultural, we as women won't be given the floor to speak because at times we will be regarded that, no, we have to keep quiet, only the men have to say some things and make decisions. So to round up, a gender responsive community that we wish for as small scale farmers should be the one that is gender inclusive in all areas. And also for us as ZIMSOF members, we are more into agroecology work. So a gender responsive service in agriculture should also include and incorporate the aspect of agroecology into, let's say maybe when resources are being allocated, as well as extension services. We lack in that area that extension services are more into conventional rather than organic, of which we are organic farmers. We also need extension services in terms of organic farming. And then, also a gender responsive service should make more efforts in assisting smallholder farmers, particularly female farmers, to join and actively participate in existing networks of agricultural communities, or to create their own traditional and virtual networks at local, national, and international level. And also, as young farmers, a gender responsive community, we should have access to reliable and timely information in our communities. I guess that's all. Thank you very much.
Thank you so much. Those were the testimonies from the two young people from Binga and Mutoko, where they have highlighted the various challenges that are faced, particularly for adolescent girls and young women and women smallholder farmers in Mutoko. Action Aid, do we have any more presenters? Okay, thank you very much. I think maybe.
Hello, Madam Chair.
Please go ahead.
Thank you very much. Maybe to add to what Chenge, the small farmer, has just been alluding to. I think the other testimony that is so real is that in the villages you could see maybe a scorecard written Mr. Due and Sons.
Sorry,
Then
Mr.
wonder
Chikoe.
where the mother and daughters are.
Mr. Chikoe, sorry
that's
to
one other
interrupt
thing
you.
in
Are you
terms of
able to
gender
put on your
responsiveness
video?
that needs some kind of behavior change, because mostly there's a bias towards the promoting men in agriculture, and women are only left with the pertinent issues such that they are city custodians. But when we come to things that are valuable, like getting some loans, getting some inputs from government, women are not valued. But they are popularly known as custodians of city, which is just a pertinent issue. So I was just adding to testimonies that are so real in our real life, where you see somebody, maybe they've been working with the mother and the daughters in the fields, but when they acquire property like a Scotch cat, it's written Mr. Due and Sons, where the mother and the daughters are missing. Thank you.
Thank you so much for that addition. We will now have breakaway sessions. One will be on health and the other one on agriculture. I'll request my colleague, the IC team, to lead us in how we are going to log into those two different sessions. The IC team, please, can you assist us?
Yes, I will be creating two breakout rooms, and each will just have to choose whichever breakout room they'll be in. One is it will be named agriculture, and the other one will be named health. So as soon as I open the rooms right now, you should see at the bottom screen, or bottom right of your screen, an icon called room. Can I have a confirmation that you can see that notification? Bottom
No,
right.
not yet. Oh, there.
Anything of agriculture.
There's nothing at the moment.
Yes, because I'm seeing people joining. So can you see?
Is agriculture. How can I get to agriculture?
Bottom right, you should see breakout rooms. You press on breakout rooms, and then you will have the two rooms that will open, and then you choose whichever room you want to go to.
And agriculture, I don't want it.
Okay. If you are not able to join, you can just notify me, and then I'll add you to the room. Because I'm seeing people joining the different rooms.
I also want to go to the agriculture room.
Okay, I will be adding you right now.
Masia agriculture.
Yes, ma'am.
Boy.
Kumalo agriculture.
Agriculture.
I'm so sorry, I was responding to a call. Okay, so can I please hear more of agriculture?
Fresca number agriculture.
Okay, Fresca agriculture. Okay, anybody else go in agriculture?
Have you added Honorable Mohadi in agriculture?
Yes. Masia.
Okay.
Masia
agriculture.
Okay, just 1 second. There's somebody who's asking for help in the agriculture breakout room. I will be right back.
Please, the one leading, can you recognize the Kumalo, Honorable Kumalo, for agriculture, please?
Hello. I'm going through the names that I can add the question.
Can you read the names?
Okay, I saw in the chat somebody said add Masia agriculture.
Yes.
Okay, and then there's another one that said health. I believe the person is already added to health. Anybody else?
Yes, please confirm for Honorable James Sitole. Which group is Honorable James Sitole?
Okay, let me just go into the group and confirm. Okay, I'm not seeing in any group.
Honorable Nkani, health.
Honorable Nkani, health, okay. Okay, done.
Okay, may you therefore put Honorable Stole in agricultural group?
Honorable Sansole.
Can you also confirm Honorable Mohadi?
Yes, I sent Honorable Mohadi in agriculture, I believe.
Okay, thanks.
Can you assign Honorable Sitole in the agricultural group?
Okay, okay, that's done. Is there anybody else who would like me to assign them to a group?
Honorable members and distinguished participants, I hope we have managed to join the respective rooms, that is agriculture and health. Just in case you have not managed to do so, kindly let us know so that we can assist you.
Okay. And please, you need to accept when you are added, you need to accept, because I'm seeing some have not accepted yet the invitation to join the room.
Sorry, we're waiting to be admitted in the health group. Honorable Ndiweni.
Okay.
Honorable Tongova. Honorable Molokeli.
Hello, how are you?
Honorable Tongova.
You're speaking to Honorable Abote.
Okay.
Yes, I'm expecting a little bit of money from you. Have you forgotten me? The lady you took for the lady you took some material. You don't know my name. Right. Hello.
Honorable Ndiweni, in which breakout room? Honorable Ndiweni, in which breakout room?
Honorable Ndiweni, kindly assist us which breakaway room you'd like to be added to.
Okay, let me give you a list of honorable members that want to go into health.
Thank you.
There is Honorable Ndiweni.
Okay.
Honorable Labode. Honorable Molokeli. Honorable Kwaramba. Honorable
We seem to have lost Honorable Ndiweni, but
No,
so
I think
far.
I think he joined the health group.
Okay, so did you get Honorable Ndiweni, Honorable Labode, Mulokeli, and Honorable Kwaramba?
Yes.
In the health room.
Yes, I'm just looking for the last two because I need to read the names.
Okay.
Yes, but Honorable Labode is already gone.
Okay.
Has my name been confirmed, Honorable Nkani for health?
Honorable Nkani for health, okay. I have added you already. You just need to accept my invitation to join the health group.
Please add me on health, Honorable Mkoni.
Okay. Yes, Honorable Kani, you need to accept the invitation to join the breakout room.
Do we still have any honorable members who wish to join the breakaway rooms?
My apologies. I was called in one of the rooms to assist.
Kindly add Honorable Neri to the health breakaway room.
Honorable Mary, just 1 second. To the health?
Yes, health.
Perfect, done. Honorable Andrew Kani need to accept the invitation to join the room. He still has not accepted the invitation yet.
We are still calling on more honorable members in case there are some who have not yet joined the breakaway rooms for health and agriculture. Kindly indicate which room you'd love to be added to.
Yes, there are both of them.
Honorable Mpariwa, you have your hand up.
Yes, may you kindly admit me into the health.
Thank you, Honorable.
What if you decide not to send me?
ICT team, did you get that?
Yes.
Yes, yes. I've done that already.
Okay, thank you.
No, you can say, me, I can't. You can say it. Or in the letter. Oh, yes, yes, yes. In that letter, yes, ma'am. Oh, I think I left that one on your right. Oh, come on. I think it was just an oversight.
Mr. Kongolo?
Yes, ma'am, I can hear you.
Yes, please. Is it possible to keep on adding honorable members and others as the meetings go on in the respective rooms so that maybe we can start? I don't know if they've started. I haven't yet joined any of the rooms.
Yeah, they are already discussing in different rooms.
Okay.
Yes, so I can definitely add them as they join.
All right, thank you.
Virginia Mafuta to Agricultural Group.
Sorry, is there any honorable member who would like to join the two rooms, the agricultural or the health? Please just do let me know and then I will add you.
ICT, please note that there is still some people in the breakout room for agriculture.
Okay. Do I need to bring them back?
Yeah, I mean, I think the meeting there is done.
Okay.
Sure.
Welcome back from the breakaway session. I think we still have some people who are, haven't left the breakaway rooms. Maybe we just give them 2 minutes so that Ms. Makombe and Mr. Mzingwa can just give us a summary of the discussions that took place in the respective breakaway rooms.
Also, if there are no discussions happening that side, I can just close the different rooms.
Kindly do so, please.
Okay, I'll do that now.
Okay, thank you.
And so you find that writing itself also has a effect on the service delivery. The construction of many health centers structurally, I think we should, I would like to commend the business structure.
Ms. Makombe or Mr. Muzingwa, are you ready to give us a summary of the discussions from the breakaway rooms?
So we have a big number of lessons because and so that in itself also created a problem in that we have factors which are becoming right. Some of them are becoming white because
Honorable members, kindly bear with us. We're just waiting for the moderators to just give us a summary of what transpired in the breakaway rooms.
I think also the other point is testing
Action Aid, are you ready to give
Yes,
us a
yes.
summary?
Yes,
Please
I'm
go
ready.
ahead.
Yes, my name is Richard Mambewa, representing the agricultural group. Can I go ahead?
Please go ahead. Is it possible to have your face show us? You can switch on your video.
Okay, can you see me now?
Yes, please. Thank you.
My name is Richard Mambewa. I'm representing the agricultural group, breakaway group, but I'm consulted with the ZIMSOF and the SAF Regional Office Tanzania. From the group, there were so many issues that I highlighted, but the major points are around the issue of advisory and extension services. How can smallholder farmers work with the officers within the advisory and extension services? But also we realize that there are so many challenges with regards to their capacities of the capacities of the officers, such as mobility, equipment they use, the number of farmers or they can reach. Consider that there are very few within the areas that they are operating as a summer. Then also issues of around the young women and the youth in rural areas. They do not own anything such as collateral. They do not own land. They do not own, so they cannot even afford access to loans from banks. So we also talked of the 10% actual budget support, that it is not reaching out to smallholder farmers within the rural communities, but it is reaching out to the large scale commercial farmers. Then also the issue of budgeting and the policy-making processes. There's little consultation with rural smallholder farmers, and information is not circulating to these rural communities. Then also on the issue of market access, it is still a challenge as smallholder farmers have to transport their commodities to Mbare Musika, where they are meeting up with the middlemen, the Makoronyera, who are exploiting them of their produce. But also the issue of the infrastructure at Mbare Musika around water and sanitation, it's not favorable to the conditions of smallholder farmers. But also we realize that for us to deal this, our honorables can take up this issue of value addition and processing, so that this can be done within the rural communities rather than for farmers to come with their produce to Mbare Musika. And also, we're also urging that there's need for capacity building for the farmers to do market research for the type of produce they want, for the type to understand the type of produce their customers want, so that they can produce according to demand rather than producing after just saying, like, for the sake of producing, or seeing someone producing tomatoes or cabbages, but they need to produce after finding out what the customers want, or maybe linking up with certain supermarkets or wholesalers, or even value processors on the type of products, agro products that they want, so the farmers they produce according to demand. Then also on the issue of infrastructure development, such as roads, and this is still a challenge within the rural communities where we are operating in. Then on issues of climate change and water development, I think climate change is a it's a very important issue that needs to be dealt with within our rural communities. And also farmers need to be capacitated on the type of crops they need to produce according to their agroecological zones. Then on the issue of farm input support programs, there is that women and the young women within the rural communities, they are not consulted, and they are the last to benefit from these programs. I think, and also the last point was on gender-related budgeting, how it should be sensitive to the needs of women. Thank you. Madam Chair, thank you. This is the end of my presentation.
Video on. Okay, that's fine. Madam Moderator, afternoon, everyone.
Good afternoon.
Okay, am I audible?
Yes, you are.
Okay, this is Azima Kumbe giving feedback on the health group work. The first one was closing legislation gaps to allow the young people to enjoy their sexual reproductive health rights. So there was a proposition to review Section 35 of the Public Health Act. And then still on that legislation, there was a proposition to build a critical mass of members of parliament to advocate for this legislative change. It is not a one-off thing, but I think if people put their heads together, that would assist, because at the moment, people felt there's a balance between normative issues, the parents, as well as the young people who are supposed to get the services. So it would be good to look at the legislation and address the age of consent. There was also a proposition that parliamentarians should visit youth institutions for them to get information on what issues are affecting youth within those institutions. And then there's also a need for training of youth so that when they are given a forum, they are confident enough to say out their needs to the parliamentarians or to the powers be. And then there was something positive also which we had, because we had asked a question on how can monitoring of the public resources be done in a transparent way. And then we were informed there are now post-budget consultations as opposed just to pre-budget consultations previously. And then secondly, also, there are feedbacks which are given to the communities on the activities which have been committed to be done, whether they were successful or not successful, which we thought was very, very positive. And I think that one needs to be applauded, really, that the communities are kept aware of what exactly is happening to their resources. Otherwise, thank you very much. Back to you, Madam Moderator.
Thank you very much.
Something I think the honorable members can add if there was something critical, which I failed to capture.
Thank you very much. Honorable members, are there any reactions to the feedback that has been given by Mr. Muzingwa, or rather the representative from Action 8 on health, and also from Mrs. Makombe? Are there any reactions, honorable members?
For us, it's a true record for the health team.
Thank you, Honorable Abode.
Madam Moderator, I think on the agriculture, the presenter left out the issue of title to the land.
I can't get you clearly, Honorable. Could you please just repeat the question?
Yes, we left out the issue of title to the land, the issue of land ownership.
Thank you. I'm not seeing any other intervention. Action 8, are you able to respond to the issue of title to land? Action 8. Action Aid, are you able to get me?
Yes, Madam Chair.
Thank you very much. There is an issue. Honorable raised an issue that was not covered in your summary, and that has to do with title to land.
Yeah, thank you very much. Maybe in regards to the land issue, smallholder farmers are always having battles with the so-called investors who come to their land. Maybe they might be doing land mining or any other activity that they might get land maybe from authorities. So I think the issue to do with the title deeds is something that actually we have been waiting for all over the years. If that could be made to avail the title deeds to smallholder farmers, I think it's something that has been long overdue. Then also maybe to add to what the moderator from the agricultural sector was saying, I thought maybe we were appealing to honorable members so that maybe if we could be allowed to draw an action plan that will allow for capacity building of farmers and the stakeholders, so that we don't point a finger to say it is because of so-and-so who is not making things go well. So as farmers, we are used to having some face-to-face in the meetings. So we are suggesting and appealing to honorable members so that we could have some interface meetings between farmers and the MPs, and would also allow for a study tour of the portfolio committee in agriculture to actually visit the farmers and see the innovations that the farmers have that could also maybe be incorporated into the agricultural policy framework. Like, for example, we've got farmer innovations in the rural areas. I was saying this from the agricultural group to say we have farmer innovations that are low cost and sustainable. For example, the water harvesting techniques that the farmers are into, unlike whereby government will end up having lots of monies to drill bores, which will never be closer to each and each and every farmer. So I think our suggestion are the 3 points to say we need to have some capacity building training, maybe of the farmers and the MP members of parliament, and also to have some interface meeting between farmers and the MPs. And lastly, to have a study tour of the portfolio committee in agriculture to come and witness the evidence of what the farmers are into. Thank you, Madam Chair.
Thank you very much. Action 8. Honorable members, I hope that response from Action 8 is satisfactory. Are there any more questions or clarification, honorable members?
Satisfactory, thank you.
Thank you, honorable. Thank you so much. I think at this moment, allow me to call upon Honorable Ndiweni and Honorable Kwaramba to lead this session. Honorable Ndiweni will make the presentation on what the Parliament of Zimbabwe can do to address social accountability gaps in the implementation of regional commitments. And Honorable Kwaramba is going to moderate the session. Honorable Ndiweni and Honorable Kwaramba, you have the floor.
Okay, thank you very much. Thank you. I am privileged to chair this session that is coming at the end of an engaging program on what we as Parliament and our various stakeholders can do to enhance social accountability in the health and agriculture sectors. I am sure that we've gained a lot in the previous sessions. Let me just take this opportunity to introduce our next presenter on the topic, Honorable Daud Nduweni, who also is a delegate to the SADC Parliamentary Forum and serves in the Executive Committee of the SADC PF. After this presentation, we will go straight into discussions before I hand you over to the Secretariat to complete the program. I thank you. Honorable Nduweni, over to you.
Thank you very much, Madam Moderator, Honorable Karamba. Thank you very much to the overall session moderator. All protocols observed. Mine is not a very difficult task that I've been given. What I want to elucidate to you is what the Parliament of Zimbabwe has to do to address social accountability gaps in the implementation of regional agreements. Firstly, we look at the social accountability part. Social accountability is a fairly new notion of governance, which fuses, intersects with, and enhances renowned principles like integrity, openness, transparency, equity, effectiveness, etc. Social accountability is in fact an adaptation of accountability. Accountability being a governance mechanism that involves identification of responsibility, availing information, explanation and justification of policies, plans, actions, and results, which are appraised and sanctioned accordingly. It is a demand-side, bottom-up driven governance concept, if I'm quoting Dan Ringgold as of a publication in 2012. It's hinged about the ideology that civic actors, including individual communities or organizations, can influence the quality and efficiency of service delivery through holding the service provider and duty bearer to account. There is no better way to public accountability than to let consumers of services and products determine what they want, monitor how services are delivered to them, and thereafter assess what they are getting. Accountability is an approach towards building accountability that relies on civic engagement. For example, in which it is ordinary citizens or civil society organizations who participate directly or indirectly in exacting accountability. If I have to quote the World Bank pamphlet as of 2004. The inclusion of sanctions in social accountability is important and given the concept power to deliver. I'm now looking at parliaments and social accountability. In a democratic state, the institution of parliament is a model of civilization based on fundamental concepts of democracy, transparency, and accountability that states that the authority of government originally belongs to indefeasible and inalienable rights of the governed. If I have to quote Gabriela Neptoi as of a publication in 2014. For parliaments to successfully rescue democracy and social accountability in the time of COVID-19, they need not only to be existent in session, but most importantly, capacitated, autonomous, and wielding enough power and influence over the executive. Madam Moderator, I'll look at the social accountability gaps in the region. Across many societies and countries in Africa, and maybe SADC in particular, there are common challenges and gaps to progressive realization of social accountability as listed by PSMAM of the Rhodes University. The first gap that's been identified is government strategic plans not based on a proper needs analysis. The second gap that was identified is budget allocation not based on strategic plan activities and planned activities and programs that are not properly costed. There is also weak financial management controls that create space for misuse, abuse, or corrupt leakages. The other gap identified is performance management needed to translate plans into services, which is weak and at times not inexistent. Government departments and service agencies have been found to fail to account to constitutional oversight institutions. For example, the Supreme Audit Institution and parliamentary committees, etc. The other gap identified is lack of political will and desire by government to uphold and institutionalize an obligation to justify and explain its decisions and actions to its citizens in its core public resource management, PRIM documentation as a matter of course, and to take timely corrective action where weaknesses are identified. The last gap identified is capacity constraints within Parliament to execute representative and oversight functions. Madam Moderator, I'm now looking at Parliament's role in propagating social accountability. Parliament of Zimbabwe passed very progressive social accountability legislation, which if implemented will be an envy of many states. The Constitution of Zimbabwe Amendment number 20 of 2013 has several provisions that allow the enjoyment of the right to social accountability as highlighted by the table that I'm going to go through, Madam Moderator. The table is divided in two where we look at the section and the provision. The first section in the Constitution is section 3, subsection 2G, founding values and principles. That's the provision, founding values and principles. It states the principle of good governance, which bind the state and all institutions and agencies of government at every level, include G, transparency, justice, accountability, and responsiveness. Section 11 states that, I quote, the state must take all practical measures to protect fundamental rights and freedoms enshrined in Chapter 4 to promote the full realization and fulfillment. Section 13, subsection 2 of our Constitution, Madam Moderator, talks of national development. I quote national development. Measures referred to in this section must involve the people. It's underlined, involving the people in the formulation and implementation of development plans and programs that affect them, close quote. Section 62, subsection 1 of our Constitution, I quote, reads its provision: every Zimbabwean citizen or permanent resident has the right to access to any information held by the state or by any institution or agency of government at every level, insofar as information is required in the interest of public accountability. Section 62, subsection 2 of our Constitution provides for, I quote, every person, including the Zimbabwe media, has the right to access any information held by any person, including the state, insofar as the information is required for the exercise or protection of a right. Section 68, subsection 2 provides, I quote, for any person whose right, freedom, interest, or legitimate expectation has been adversely affected by administrative conduct, has the right to be given promptly and in writing the reasons for the conduct, close quote. Section 141, section A reads, I quote, Parliament must facilitate public involvement in its legislative and other processes, close quote. Section 194, subsection E, I quote, states, people's needs must be responded to within a reasonable time, and the public must be encouraged to participate in policy making. Section 194, subsection F provides for, Madam Moderator, I quote, public administration must be accountable to Parliament and to the people. Section 194, subsection H provides for, I quote, transparency must be fostered by providing the public with timely, accessible, and accurate information, close quote. Section 242 of our Constitution provides for the establishment and composition of the Zimbabwe Human Rights Commission, whose functions are provided for, Madam Moderator, in section 243. The functions of the Zimbabwe Human Rights Commission, section D provides for, quote, to receive and consider complaints from the public and to take such action in regard to the complaint as it considers appropriate, close quote. E provides for, I quote, to protect the public against abuse of power and maladministration by the state and public institutions and by others of those institutions. Madam Moderator, in addition to the Constitution of Zimbabwe, as derived therefrom, there is in Zimbabwe a Public Finance Management Act, Chapter 22.19, whose object is to secure transparency, accountability, and sound management of revenues, expenditures, assets, and liabilities of any qualifying entity. Another key legislation is the Audit Office Act, Chapter 22.18, which further stipulates and establishes the office of the Auditor General, then called the Comptroller and Auditor General. The Audit Office and the Audit Commission. These are the major pieces of legislation that stipulates operational details and establishes offices that govern, that germane to upholding the right to social accountability. There is otherwise other smaller acts like the Procurement Act, Chapter 22.14, which is important in expenditure and integrity management process of social accountability. Parliament, because of its nature, has a constitutional mandate to ensure social accountability in implementation of regional and domestic agriculture and health agreements or commitments, which is as follows. Bulletin 1 is to make good laws and to ratify international treaties. Secondly is representing the needs of the people in governance. Thirdly, is scrutinizing and approving national budgets, ensuring that adequate funds are allocated to this sector. Fourthly, scrutinizing existing national agriculture and health policies. Fifthly, is to provide oversight on the executive arm of government, demand accountability, this function has several objectives and goals, including but not limited to, Madam Moderator, improve the efficiency and effectiveness of governmental operations, evaluate and monitor programs and performances, detect and prevent poor administration, waste, abuse, arbitrary and capricious behavior or illegal conduct, protect civil liberties and constitutional rights, inform the general public on government activities and ensure that executive policies reflect public interest, gather information to develop new legislative proposals or amend existing statutes, ensure administrative compliance with legislative intent, and lastly, to prevent executive encroachment on legislative authority and prerogative. In conclusion, Madam Moderator, parliaments are integral to social accountability establishment, implementation, and evaluation. The principle of separation of powers is critical and underlying for any parliament to be able to defend social accountability and democracy. A rubber stamping parliament that cannot exercise its constitutional oversight powers and bring the executive to account on behalf of the citizens will fundamentally not be able to protect social accountability and the rights and needs of the governed. I thank you.
Thank you very much, Honorable Diweni.
I'm managed what social accountability. So thank you. Technology. He has also managed to explain to us how parliaments can operate, and has managed to identify sections in the Constitution which speak to social accountability. Now, he has ended up by explaining to us the importance of the separation of powers. Now, I'm saying, honorable members, if there are areas that you want to be to be explained, you can now ask. This is the time. Honorable members. Yes, Honorable Molokele.
Thank you so much, Madam Moderator. Thanks even more to Honorable Ndiweni for his well-researched and committed presentation. Mine is just a point of emphasis. When we talk of social accountability from a Zimbabwean Parliament point of view, I think in my 3 years in Parliament, one of the things that I've discovered, which I would not have imagined before I was elected as a member of Parliament, is the power of the portfolio committees. Because the portfolio committees are not as public and as spectacular as our assembly sessions. But what the portfolio committees do is the dirty work behind the scene. Especially in Zimbabwe, when you've got an issue of social concern, I think the Parliament of Zimbabwe is at its effective best through the portfolio committees, especially if you evoke the section on the Constitution around the petitioning of Parliament. Once a petition is recognized and endorsed by the Speaker, it is assigned to a relevant committee. And normally that portfolio committee is very thorough. It normally does public hearings. Sometimes it calls the relevant stakeholders to do oral presentations. It even calls government officials, such as ministers, deputy ministers, permanent secretaries, and it comes up with a well-documented analysis and in a report. And it even makes clear observations, and then it makes strong recommendations. So I think the use of portfolio committee to promote social accountability, especially through petitioning Parliament, is a very effective way which Parliament of Zimbabwe is playing a role, and something that I wanted to reflect on.
Thank you very much, Honorable Molokele. He has pointed out the importance of petitions, that these are very important and they help to unravel some gray areas. Any other discussions? I think this silence means that the topic has been exhausted. May I hand you over to the Secretariat? I thank you.
Thank you very much, Honorable Kwaramba. Honorable members and distinguished participants, we are almost coming to the end of the program. I must say that it has been a very good meeting, and the active participation of honorable members is an indication that issues of health and agriculture are quite emotive. And I can also say that these issues cannot be exhausted in one sitting alone. As we heard from the presentations, that there's need for more engagements, especially with the different portfolio committees, with the smallholder farmers, and also to involve the young people with issues to do with adolescents and young people, reproductive health services. Let me not keep you longer. I'll now call upon Ms. Moyo to give her closing remarks. Ms. Moyo, please.
Madam Moderator. So mine is a very short and brief task to give remarks on the PSA Alliance. And once again, all protocols observed to the honorable members here present. So on behalf of the PSA Alliance, which includes Action Aid Zimbabwe, SAFE, ZIMSOF, and SABST, I would like to take this opportunity to thank the honorable members here present and those who are with us from the morning session right through to the end. The SADC PF chairperson, Madam Poema Sehoma, the SADC PF Secretariat, the Parliament of Zimbabwe, honorable members of the portfolio committees on health, agriculture, as well as the Parliament of Zimbabwe Secretariat, the consortium members here present, our community participants from Binga and Mutoko. Thank you very much for the time you've taken off your busy schedules to be here present on this virtual meeting on oversight, on strengthening oversight on health and agricultural issues. Indeed, this meeting has managed to meet the objectives it set out to address. Parliamentarians and participants managed to deliberate and assess the progress Zimbabwe has made and the steps Zimbabwe is taking towards the realization of regional and national commitments that the country is signatory to on agriculture and health. Secondly, discussions around the challenges in social accountability within the health and agricultural sectors were discussed at large, and this has been witnessed by the extensive experience and shared, that is the shared experience that we got from our young people within Binga and Mutoko, as well as from the farmers that we have here present. Lastly, reflections on the on how national parliament interventions to enhance social accountability have also been made. Of particular note, the motion on reviewing Section 35 of the Public Health Act has been stated, as well as the suggested study tours to showcase farmer interventions. As the PSA Alliance here in Zimbabwe and consortium members, we will be taking up these recommendations as well as these suggested interventions and continue our engagement with Parliament in their capacity on the roles they play within legislature, oversight, and representation of the citizens of Zimbabwe. In concluding, we have also learned a lot on how we can engage with Parliament, particularly the power that the portfolio committees hold. And this, as an alliance, we will continue to engage and strengthen our engagements with Parliament. Once again, thank you very much to the members of Parliament here present and to our partners. Thank you, and over to you, Madam Moderator.
Thank you so much, Ms. Moyo. Let me now call upon the chairperson of the Portfolio Committee on Lands, Agriculture, Water, Fisheries, and Rural Resettlement, Honorable Wadiajena to give the closing remarks. Honorable sir.
Honorable Wajajena is muted.
Okay.
Somebody's making noise there. Can they please mute their devices?
ICT, can you help us to mute all the people who are not speaking, please?
Thank you, Madam Moderator. Good afternoon, all. Let me begin by thanking all honorable members present for their participation in this program. I'm sure you found it as informative and impactful as I did. And no doubt we will all set off from here at top speed, eager to put into practice all we have learned. I would also like to extend particular gratitude to the Secretary General of the SADC Parliamentary Forum and the PSA Project Manager for making it possible for us to host this meeting. Thanks also goes to all the impressive facilitators and experts. We are all in your debt for the truly remarkable and valuable, knowledgeable, and lessons you shared with us throughout the day. Honorable members and dear colleagues, as the Parliament of Zimbabwe, we are all honored to be among the 5 countries that have been identified to participate in this project. As legislators, we recognize the importance of continued education in and around the subject that are core to our work in Parliament. I cannot state enough how much possibilities opened up when we are informed, curious, excited, and driven about the technical aspects of our subject matter. This practice of upskilling and training is what allows us to meaningfully contribute to effective policymaking and to current and relevant discourse on our subjects. I know that these lessons shared today will contribute to the overall development efforts being undertaken in Zimbabwe in the areas of health and agriculture. This meeting is highlighted and somewhat demystified some of the challenges that Zimbabwe faces in social accountability within our health and agriculture sectors as they apply to HIV and sexual and reproductive health services. We heard from the presentations that were delivered that some of the key factors that cause the health and agriculture sectors to lag behind stem in part from the inability by member states to domesticate regional commitments. We recognize that some progress has been made towards the realization of key regional commitments in health and agriculture here in Zimbabwe, but more needs to be done, and we still sit in full awareness of our own role and the parliamentary interventions that could enhance social accountability. Furthermore, the COVID-19 pandemic has continued to strain the national budgets of many countries in the region. In order to mitigate some of the effects of the pandemic, member states are compelled to realign or divert resources. As a result, it has been difficult to provide certain health services around HIV and sexual and reproductive health, which is of great concern. Failure to provide these basic services to certain demographics is potentially grave and far-reaching effects, including an increase in teenage pregnancies and an increase in our HIV infection rate, among a variety of other problems. Today, we also are apprised of the need to thoroughly understand the impacts of climate change on agricultural productivity, a subject very relevant to drought-prone Zimbabwe. This served as a reminder to double down on implementing climate mitigation measures to ensure the food security of us here at home. Honorable members and dear colleagues, in achieving social accountability, our role as legislators requires us to enhance our oversight function to ensure prudent utilization of public resources and adequate allocation of funds towards both health and agriculture. We must enforce accountability. Efficient implementation of key programs in both these sectors is vital to the overall social and economic development of our nation, and crucially, our ability to achieve Vision 2030. In closing, honorable members and dear colleagues, I'm delighted to state that this meeting has been very participatory, and it has been possible to hear a wide range of expert views and participant experiences. However, I'm sure you can all agree with me that these matters that we've discussed today, though broad, they have not been exhaustive. And for this reason, we hope that more events of this nature are planned in the future. Thank you all once again and have a good afternoon.
Thank you very much, Honorable Adjena. I now call upon the last speaker, and this is Honorable Labode, to give a vote of thanks.
Hello. Thank you, Madam Moderator. On behalf of the Speaker of Parliament of Zimbabwe, and indeed on my own behalf, I wish to convey gratitude to all honorable members of Parliament for your attendance and active participation. Let me also extend special thanks to the Secretary General of the SADC Parliamentary Forum, Mrs. Poema M. Sekoma, and Mrs. Julie Middleton, the Manager for the Partnership for Social Accountability, PSA, for facilitating this meeting. We are aware that the commencement of this project coincided with the COVID-19 pandemic and the attendant restrictions that rendered hosting of physical meetings impossible. Nevertheless, in a quest to mitigate these challenges and to ensure that the business of SADC did not come to a standstill, the SADC PF developed a framework to facilitate hosting of virtual meetings for its organs, including standing committees. For this, you are greatly commended. Lastly, I wish to extend appreciation to all our resource persons for their invaluable input to this meeting. I thank you.
Thank you very much, Honorable Labode. Honorable members and distinguished participants, we have come to the end of our program. Thank you very much to you all.
Thank you.
Why you want to border? Why you want to border?
Push up.
ICT, let's